from a rural village, I've seen a lot, I'm still seeing a lot, that I feel I can contribute towards strategies that could assist in ensuring that use of drug it's reduced, and also the harm thereof. And also from the local municipalities, I realized that when you take HIV, nationally it is chaired by Deputy President. When you go to the provinces, the Premier, and down to the locals are mayors. But with substance abuse, there are no activities that are taking place that could assist in reducing the scourge of substance abuse. I also want to ensure that those structures, as per the Act 70 of 2008, that is for prevention and treatment of substance abuse, it's implemented and people becomes aware on that.
Thank you. Next question.
Thank you, Mrs. Matonsi. The Central Drug Authority was established by an Act of Parliament. Which act is that, and what does the act seek to achieve?
Thank you for your question. I've already indicated that is Act number 70 of 2008, and it seeks to have a national response on reduction and reducing the harm that is caused by drug, and to implement the primary, secondary, and tertiary prevention. At primary is when you go out on awareness and implementation of programs. And if it fails, then someone gets into addiction. Then you'll move to secondary, where you'll expose that person for treatment in the relevant institution. And now you are to integrate this person back to the community. So that's what the law seeks to. And again, to reduce the supply of drugs that are coming into our country through the port. We know that we are facing a crisis in terms of trafficking of drugs into the country.
Thank you. My next question is, in your own assessment, do you think that the Central Drug Authority performs its mandate efficiently? If yes, then you must tell us how so, and if not, what are the shortcomings? You can highlight both with regards to its mandate as well as the ensuring compliance, accountability, monitoring, development, and implementation of the department's drug master plan by national as well as provincial drug master plans by provincial forums. How are you proposing to address these shortcomings?
Thank you. I would say it's yes and no. Under yes is that... pardon? Okay, thank you very much for that time. Under yes is that there's an act to that effect that give guidance on the establishment of the CDA, and also the roles and responsibility of monitoring and doing oversight, and ensuring that there are structures in place that are established according to the law, which is the Act 70 of 19. And again, one of the yes or strength is that there's the plan, the drug management, the DPMA, drug implementation plan, or master drug plan. that is in place and is reviewed on every 5 years. So it shows that government it's taking initiative to try and reduce the scourge of drugs in the country. Then on the no side is that at the lower structures, it is not implemented as expected. I've already indicated that at local level, the local drug action committees are not functional, which is supposed to be chaired by mayors, and they are not as active as the HIV/AIDS committees at the lower structures. Then one other area that I could contribute at that level is to strengthen the local structures to ensure that the programs to address substance abuse are implemented. Programs like awareness campaign, identifying the hotspot areas, coming up with the localized plan that would assist to address issues at that particular, because they will differ from one environment to other. I was looking at my province, that we are close to Gauteng, we are bordering Gauteng, and our district is close to Gauteng. There's a high number of substance abuse cases as compared to the furthest, because Gauteng is a city where there's influx of people and the access is increased. So those plans should be informed by the environment at that particular level. And again, at the provincial level, they meet, but I haven't seen activities that are unfolding to say, like the celebration of your World TB Day. I haven't heard on the 26th of June that this district or local municipality is on awareness on reduction of substance abuse. So those are the areas that one should be looking into. And stakeholder management, involvement of stakeholders. Because you find a small business who is not aware about the dangers of substance, would be selling to the under 18 alcohol and liquors. And when you look at transport, we're losing a lot of young people. Those are the areas where you need to intensify your awareness and come up with a plan, because they drink, get into the car, speed off, and we have an increased death, and that is very costly for the government to work on those.
Ms. Matonsi, the National Drug Master Plan 2019-2024 represents a multi-sectoral approach to create a South Africa free from the harms associated with drug use, drug misuse, and drug abuse. The plan observes national and international policies, plans, and conventions to ensure respect and dignity of all the people of South Africa. So the question is, if you are appointed as a board member of the CDA, you will be expected to implement the authority's mandate. Share with the panel then your understanding of the objectives of the National Drug Master Plan 2019-2024 and how you think the CDA should achieve those objectives. Thanks.
Thank you very much. The National Drug Master Plan, it's a guiding document. And one of the things that one would be looking into, it's the objectives that are there. One is stakeholder management. Okay. So one of the objectives, as I already indicated, is the stakeholder management, which need a lot to be done on that, so that all stakeholders are participating, your government departments, because they have a role to play. Your SAPS, your Department of Health. In the SAPS, we're talking about borders, they would be assisting in curbing the trafficking of drugs. Then you get to Department of Health, where we'll be able to refer those that are already, that already need treatment. You also have Department of Social Development for psychosocial support through social workers. We also have our traditional leaders. You know, during the COVID-19 lockdown, liquor was banned and cigarettes or tobacco. They were rural, traditional homemade. And when you listen at how it is mixed, it's very harmful. So they need to be aware that in their communities, they should also participate in ensuring that our kids are kept, or youth, out of access of drugs that are normally derived from the locals, not necessarily being transported from other countries. Then other objective is that the reduction of demand on drugs. Awareness campaign, prevention and continuum care, and also intervention, early intervention, when there are signs that there are drugs that are circulating. And also in the area of decreasing supply, only receiving drugs that are allowed by law for medicinal use. Because cocaine, it's a drug that is used in hospitals, but it can be abused in communities. So you ask yourself, where is the supply coming from? Because the one that is coming from health is the legal one, but people still access it. And as much as we need it, we need to control this other side of receiving it. So I would ensure that the provincial drug forums are participating and coming up with their mini master plans. And they also provide support to the locals. The communication thereof, to me, is very, very key. That what the CDA is doing should also reach the ground. A ward base, a smaller forum in the ward could assist in identifying challenges. Then you will come in with strategies of prevention. So the communication channel should also play a role. Again, research to give us information as to, for instance, what is the status quo? Where do we start? And then you'll be able to conduct research or a survey or analysis so that your strategy will exactly address challenges that are on the ground. You also look at your target group. Who are the high-risk group? For instance, it's youth. And if you do prevention, you can start at the ECD level to say drugs are not good, there's a lot of harm, and then you move on to the young ones, the youth, and say your future is in your hand. Say no to drugs, then you'll be able to. So whatever strategies you are coming with should be addressing that particular address, and CDA should be monitoring and providing support. And we know that if we could have structures at district level and moving down to the locals, then we'll be able to assist and improve the current situations.
Okay. In introducing the question, I mentioned South Africa being a signatory of international conventions. In achieving the objectives of the master plan, as a member of the CDA, how would you incorporate, what value would that have in what the CDA would do?
CDA will strengthen communication with counterparts. We'll also meet and discuss reports and challenges. For instance, when you look at the current situation where our neighboring state, Zimbabwe, was illegally taking tobacco into the country, then you have the bilateral talk with the counterpart. And again, looking at the integration of their plans and our plans. So that if we say we are reducing illegal trafficking, then you'll know, they know exactly your intention as the country. So there shall be interchange or inter-relations with other countries. And you'll also review their strategies, because you may find that they allow this drug in their area, and in South Africa it's not allowed. Thanks.
Right. The next question has to do with the National Drug Master Plan 2013-2017, where there was a need to conduct an evaluation to assess how it was implemented. Subsequent to that, the Department of Planning, Monitoring and Evaluation, in partnership with DSD, commissioned the implementation evaluation of the National Drug Master Plan 2013-2017 as part of the national evaluation system. So this evaluation took place between August 2015 and January 2016. So the question would be, what were the key findings and recommendations of that implementation evaluation? Oh, sorry.
The key findings, one of the key findings was there's a need, in fact, a weak implementation of the master plan. And that was, the recommendation was done to strengthen communication. Two was to say the structures, the Act should assist in establishing structures at both the district and the local levels. Then establishment of the structures was also indicated, and the poor attendance by the sector departments was one of the issues that was raised that need to be strengthened. And again, provision of resources to implement programs was also one of the findings that needed to be implemented in the current 2019-2024 master plan.
Thank you, Chairperson. Ms. Matonsi, what is your understanding of good governance, including its main features, and how would you ensure good governance in the CDA? You've got only 3 minutes.
In my earlier discussion, I mentioned the stakeholder management, and which is part of good governance, that you must have people who are participating in the leadership. One of the issues that in good governance is key is the involvement of all stakeholders. The Department of Social Development as a lead should ensure that they facilitate implementation of the national master plan. And stakeholders are also to be held accountable to Cabinet as the CDA, and also account to our communities. What is it that we are doing to try and reduce the harm and the effects of substance abuse? So the structural arrangement at the provincial, local sphere of government and other partners that matters, it's part of the good governance. She has already indicated the issue of other countries. So if it's good governance, it means we'll be communicating with other countries to try and resolve the challenges of substance abuse that our country is facing.
Ms. Matunzi, the next question, you have 3 minutes to answer it. What are the key issues affecting young people, families, and communities regarding drug and substance abuse? And how would you advise the government to deal with these issues?
Already I mentioned that our youth are at high risk and their families are frustrated because their kids are addicted to substances. And already the future of these kids is blurred. Now, my advice will be one, to give them information on how they should support their youth and also to support the families of the infected or affected families. The other thing is to advise them, to refer them to the treatment. If it's now secondary, if it's no more prevention, then you advise them to go for treatment. And again, you support them to say when the treatment part is done, the child should come back home. They should not they should not discriminate their child. They should provide support and advice. And if there's treatment that need to be taken or if the child need to go back for assessment, they should also provide that. And you must also assist to integrate them to the larger community so that the family is not discriminated.
Thank you, Chairperson. Ms. Matonsi, in your opinion, what is the state of public rehab centers in the country? Are there any challenges with regard to access to public rehab centers in South Africa? If yes, what are those challenges and how would you advise the country to address those challenges?
Thank you. My observation, Chairperson, has been that the centers are centralized and it's very difficult for the rural people to access. I'll give an example. Well, Gauteng has a lot of the private ones and they are very expensive. They are not affordable for an ordinary South African who might not be employed at that time, but has a child who is abusing substances. And you look at our public one in Limpopo, for instance, the center is in Polokwane, and the province is vast. Last week, I think, the mother called for assistance because their child is using drugs. And now the child was to be referred to Polokwane. And what the center is doing is every Monday they should send an official to go make follow-up on those cases, which is 200, 400 away from the center. So I would advise that if we could decentralize centers and ensure that they are accessible, especially in rural communities. Hence, I was talking on local municipality to participate so that if we establish a center at that particular local, municipality or district level, then we are sure that it will be accessible to the people who need the service. It will also be easy to do awareness campaign, but moving from a central point, going down to communities, is not very effective. So I would advise decentralization of the services, and the one in the province should become a referral. But for services to be accessible, we should decentralize. Thank you.
Ma'am, one of the challenges facing the country is the lack of comprehensive national statistics on the prevalence of substance and drug abuse. How can the Central Drug Authority play a role in this regard?
Fortunately for your question, I'd already observed that they don't have GIS system to try and track cases and the type of common substance. I just know that alcohol is one of, but if seated here, I cannot tell you the numbers to say, if I say youth, it's priority, based on what? So a GIS system is needed, urgently needed, to try and capture cases. And if we say drug trafficking, what type of drug is trafficked into the country? And I remember not very long in the news, they were saying SAPS has busted on a farm that has a lot of drug production machines. And seated here, I was asking myself, when was the plant established? And how many drugs had it already produced? And how many people were reached who received those drugs? Because as much as we are saying we're reducing the supply and the harm, there are people who are supplying within and we don't know them. So I would appreciate if such system is there to track. And if we say in KZN, they got a house that was full of machines producing drugs, for how long, and who are those people? And where are they, where is their supply, their distribution points? So that information is not readily available for CDA to take an informed decision in responding to substance abuse that is facing our country.
No, thank you very much, Ms. Matonsi. I would like to ask you a question, and then in your response, you are allocated 3 minutes. And then I would like to find out from you, recently in the country, there's been a public discourse about the decriminalization, regarding the court case on the decriminalization of marijuana, cannabis. So I would like you to share with the panel, what is your opinion regarding that court judgment? Thanks.
You know, we are in a democratic state. And our government is making sure that we have access to services. But in most cases, those services are abused. The issue of marijuana, there are those that are saying it's for medicinal use. And there are those that their belief or their religion need marijuana. And I believe those would use it for the purpose. But if it's accessed by everyone, there are those that take advantage of allowing, because these people have a right to choice. That's why it was allowed. so that they are able to practice and comply to their belief or religion. But me and you and other persons would take advantage and abuse those. So that's where I think the issue is. To me, it's fair to give opportunity to other South Africans who believe they cannot do without, but there are those that take advantage. I can just give a simple example in your 3 minutes, that we're giving a child support grant. There are families that are not employed. That amount assists this family to sleep having eaten something. But there are those, after collecting that, they go to the to drink alcohol. Some will go and play games, cards, and other things. So you can see that you have the positive and negative. Thank you.
Thanks. During the COVID-19 pandemic, government introduced a number of lockdown regulations to deal with the spread of the virus. Now, there was also a regulation that was introduced, which introduced the ban on the sale of alcohol and tobacco. Now, in your response, I would like you to focus more on the sale of alcohol, the ban of alcohol. So for 3 minutes, I would like you to indicate what would you advise government, if you were to advise, how to deal with the sale of alcohol during the lockdown regulations during the pandemic. Thanks.
Chairperson, unfortunately, I was part of the COVID-19 response team. And I was participating in ensuring that the rules are adhered to. And during the monitoring and doing oversight, we had this crisis that alcohol was banned. But let me tell you, you'll find people drunk in the street. There's been a lot of homemade. And when you ask them, the manner in which it was mixed just to get someone drunk, your methylated spirit and any other harmful chemicals were mixed. And people were going to bushes in rural areas, prepare traditional beers, sell there. And now it was defeating the purpose of the lockdown. So I would advise that we should continue giving information. Because when there's a rule, people should understand government is protecting us. That's why they are setting these rules. You would realize that when people are drunk, they would not do social distancing, they would not put on masks, they will meet in huge numbers because they want to be together while drinking. So I think we need to be proactive to give information. I always say our government has very good legislation, but I think we need to come with a strategy of giving people, while it's still okay, information on why this is to be done. When we conduct hearing before the bill is passed, let's do the same and give information. Government will be coming up with this legislation. And why? Why are we to comply? It's for the sake of our health and our safety. So I think those are the things that we need to emphasize at all times. We must reach our people.
Thank you. Is there any question that you would like to ask the panel, or is there any comment that you want to?
Listen, I don't have a question, but I'm impressed the way your questions has been structured. If wishes were horses, the CDA will be able to implement and it will have impact in people's lives. So these questions are actually looking at the challenges and seeking strategies to address. So I really appreciate your panel and the manner in which you structured your questions.
Thank you, Ms. Matonsi. Thank you for your participation. You are excused. Thank you very much. And we wish you a safe journey back home. Good morning. Good morning, Ms. Tema. Welcome to this interview. My name is Marentia Gillian. I'm the chairperson of the session. I will also ask the other members to introduce themselves. Member Stock.
Thank you very much. Good morning, Ms. Tema. My name is Dikhang Stock. I'm a member of the Portfolio Committee on Social Development, as well as the subcommittee which deals with the interviews. Thanks.
Good morning, Ms. Tema. My name is Bridget Masango, a member of the Portfolio Committees on Social Development and also part of the subcommittee conducting interviews. You are welcome this morning.
Morning, lady. I'm Letitia Aris. I'm a member of the Portfolio Social Development. Welcome here.
Good morning, Ms. Tema, and welcome. I am Dalmaine Christians. I'm a member of the Select Committee and of the Subcommittee.
Good morning, Ms. Tema. My name is Otto Malik. I'm a member of a select committee and a subcommittee.
Thank you very much, members, for that introduction. Ms. Tema, I will straightly go to the first question that I will pose to you. And Just relax. If you feel comfortable, you can take off your mask. Now you can tell us a bit about yourself and why are you interested in committing your time and energy to serve on the CDA board? And if you will be appointed, what will you bring into the work of the CDA? You can have that conversation in 3 minutes. Thank you.
Thank you, Chairperson. I am Dimakato Jane Tema. I'm a pastor and a director of an NPO called Dimakato J. Tema Prevention and Aftercare Center. We have started the NPO in 2015, November, and we are intensively interacting with the people who are using the drugs in Bela Bela, more especially Nyaope. And what we are also doing on daily basis before these lockdowns is I would go to the schools, go to the other churches and talk about the prevention on the drugs and substance abuse to the children at schools, and as I've indicated. From our NPO, we started as a rehabilitation center, whereby we would have more than 100 of the people who are using drugs, both male and female. And we managed to rehabilitate about 54 of them who are currently, since 2015 to date, who are currently clean, not using the drugs anymore. And as a pastor, I've realized that we cannot just have a church and preaching on Sunday, but whereas we have social ills, because in our province, I believe Bela Bela is a town where we suffer most with children using, or youngsters using the drugs. And another thing, what prompted me to do this is because of the crime rate that was going high, and we were burying about 40 children per month who are using these drugs, and hence we started this and the NPO just to assist, just to be hands-on, just to do something for our community in Bela Bela. If I were to be appointed in the Central Drug Authority Board, I would bring the experience that I have in trying to get this, the drug addiction, the experience that I have in prevention, the experience that I have in an aftercare service, and to
Thank you.
reintegrate the abusers back to the community.
Thank you. Your time has expired on that question. Can we move to the next question, please? Thank you.
Thank you. The Central Drug Authority was established by an Act of Parliament. Which act is that, and what does the act seeks to achieve?
Okay. The act is Prevention for and Treatment of for Substance Abuse Act number 70 of 2008. The act, what try to achieve is to combat the abuse of drugs. This act is to bring the government together so that they can together deal with the abuse. The act, again, what it needs to achieve is to give guidance to the nation in terms of the drug trafficking. And another thing that this act speaks to is the development of the National Drug Master Plan, of which needs to be reviewed after 5 years, and that, okay, it needs to be reviewed after 5 years, and again, it's a advising document or a guiding document to the minister or to the government as whole on the issues of drugs. And this act again seeks or encourages other departments to have the performance indicators or to have their own plans on the issues of drugs and substance abuse. Thank you.
In your own assessment, do you think that the CDA performs its mandate efficiently? If you say yes, how? And if not, what are the shortcomings? You can highlight both with regards to the list mandate as well as ensuring compliance, accountability, monitoring, development and implementation of the department's drug master plan by national and provincial drug master plans by provincial forums. And then the other question is, how are you proposing to address these shortcomings?
I don't think I got your questions clearly. May you please repeat it for me?
You can write it down as well. Okay. In your own assessment, do you think that the CDA performs its mandate efficiently? If yes, how so? And if not, what are the shortcomings? Then I say to you, you can highlight both with regards to its mandate as well as ensuring compliance, accountability, and monitoring, development, and implementation of the department's departmental drug master plans by national departments and provincial drug master plans by provincial forums. Then I ask you, how are you proposing to address these shortcomings?
Okay, thank you. You see the National Drug Master Plan on its mandate to ensure that the CDA run efficiently. I can say, according to the objectives and what is in there, it's good. But however, I can see some shortfalls maybe from the members or some stakeholders that are not fully committed. You know, as we attend the meetings from the locals and provincial levels, you can see that there are some loopholes in terms of not people giving a fully attention to what is expected of them. You see that some, like for instance, when the reports needs to be submitted, I just have to be honest, then you cannot see, you cannot find those reports if you need some support from other departments. You cannot get that support. So as NGOs and NPOs, we tend to be more hands-on and fully engaged than the other stakeholders. But what I'm trying to say is, if everybody can be hands-on and the issues of accountability, on the issues of accountability, we can go and we can do a lot on that, because the monitoring and evaluation plan is there. But previously, we can see that it was not fully attended to according to the National Drug Master Plan. But however, I think with this new development, we will be able to achieve our goal, which says that we need a drug-free South Africa. So if we can, or everybody can be hands-on, I think we will do better. I thank you.
Right. The National Drug Master Plan 2019-2024 represents a multi-sectoral approach to create a South Africa free from the harms associated with drug abuse, drug misuse, and drug use. The plan observes national and international plans, policies, and conventions to ensure respect and dignity for all people in South Africa. So if you are appointed as a board member of the CDA, you will be expected to implement the authority's mandate. So if you could please share with us your understanding of the objectives of the National Drug Master Plan 2019-2024 and how you think the CDA should achieve those objectives.
Thank you, Ma. The objectives of the National Drug Master Plan, as we said, it's about to combat the drug abuse. The objective is to make sure that the spheres of the government, not the spheres, sorry, the government and, yeah, and wait a minute, they're coming together on this plan. They're coming together to work together in terms of dealing with the abuse of the drugs. So, I don't know if I got the question. Please repeat.
The question says, if you are appointed as a board member, you will be expected to implement the mandate of the authority. So if you could share with the panel your own understanding of the objectives of the National Drug Master Plan. That is the first part of the question. And the second one is how do you think the CDA should achieve those objectives?
Okay. I think that what I'm doing on a daily basis, I'm trying to, as an NGO, I'm trying to implement from time to time what is needed from the Act and both the National Drug Master Plan. So I think if the main issue in South Africa, the problem that we are having is the rate that's growing very high on the substance abuse. So the Drug Master Plan says to us that come, let's work together. Let's deal with this. Let's combat this issue of drug abuse. Let's reduce the supplement. There's a supply. Sorry. Let's reduce the supply. Let's reduce the harm that it brings. Let's reduce the demand that it brings to us. So as the CDA, we need just to ensure that we, by being like focused, giving our full attention to what is happening to this National Drug Master Plan, I think we'll be able to achieve our goal. Thank you.
Right. I just want to, because you've outlined the objectives and what people should do. I just want to take you back to where I mentioned the South Africa having signed international conventions and find out how you think that being a signatory of those conventions would assist or would add value to the work of the CDA to achieve its objectives.
Yeah, sure, that one, to be honest with you, I'm I'm not sure if I will answer it correctly. I think that it will be signing with other countries. It will serve as working together with other countries to say, look, we are having borders, we are interacting from time to time. So let's say that we as South Africa, this is our goal. We want to have a drug-free country. So it means that we are saying to other countries, this is what we want to achieve. Please don't say, yeah, please, this is what we want to achieve. Please respect our goal.
Do you think that, like the question that the honourable member was asking you, do you think that the challenges that we are facing in our country are the same as people in other countries? And how can these countries, or how can we learn from these countries, or what can these countries bring to us?
I think the drug abuse, drugs and substance abuse is international. It's the best practices that we can request from other countries that are able to conquer, and even from ourselves, what is that can we be of a role model to other countries in terms of combating this problem that we are having?
Thank you. Question 4. Member Stock.
Thank you, Chair. Ms. Thema, what is your understanding of good governance, including its main features, and how would you ensure good governance in the CDA? You've got 3 minutes.
Sorry, Chair,
Yes.
I needed to ask 3.2. Sorry, I'm very sorry.
Okay then. Sorry. We will just skip that question, so the member will ask you the question that is supposed to be asked.
Is that okay, Ms. Tema? Okay, I just want to complete, then you can go to the, I'm very sorry, that's my fault. So the question says, prior to the review of the National Drug Master Plan 2013-2017, a need to conduct an evaluation was prioritized to assess how it was implemented. Subsequently, the Department of Planning, Monitoring and Evaluation, in partnership with the Department of Social Development, commissioned the implementation evaluation of the previous plan. This evaluation took place between August 2015 and January 2016. So the question says, what were the key findings and recommendations of that evaluation? Thanks. And there's 3 minutes to respond to that question. Thank you.
Okay. One of the findings was the financial resource, the lack of financial resource for the local drug action committee, the provincial substance abuse forum. And the recommendation was that there must be a funding in that score. And the the departments, other departments that are not giving fully support, that it was recommended that the people that have to serve must be on from the directorate positions. Yeah, that's what I can think about.
Thank you. Let's move to question number 4, Maleka.
Thank you, Chairperson. Ms. Hema, what is your understanding of good governance, including its main features, and how will you ensure good governance in the CDA? Ensure a good governance in the CDA. Your understanding of a good governance.
The reporting mechanism in terms of ensuring that the good governance is there on the CDA. So we need to strengthen the report mechanism starting from the locals to provincial level, and then and see to it that the monitoring and evaluation programs are put in place at all time. Thank you.
Thank you. We can move to the next question, 5.1.
Thank you, Chairperson. Ms. Tema, what are the key issues affecting young people, families, and communities regarding substance abuse? And how would you advise the government to deal with these issues? You have 3 minutes.
Number one is the key issue that is affecting these young people is the issue of a crime. These young people, because of they want to satisfy their craving, they do their house breaks, and another thing is the death. They die in big number. And another thing is the domestic violence. It affects in the family. The drug abuse affects the family in terms of, you would see the domestic violences. The rate of schools drop downs, they no longer go into school because they are using the drugs. So these are the issues that affecting them, and even murdering each other, you know, these are things that are happening. Thank you.
Ms. Tema, how would you advise the government to deal with these issues?
if we can intensify, the government intensify on the programs of getting this, the abusers clean, intensify in prevention services. If the government can just build more of the halfway houses, if the government can have more of the centers around, that will help in combating this issue of drug abuse.
Next question, please.
Thank you, Chairperson. Ms. Tema, in your opinion, what is the state of public rehab centers in the country? Are there any challenges with regard to access to the public rehab centers in South Africa? If yes, what are those challenges, and how would you advise the country to address those challenges?
You see, a challenge, I don't think it's coming basically from the rehab centers, but it's because it happens because of when the abusers, if I may to call that, come back, the aftercare, it's needed because of, why am I saying this? It's because of the relapses. Because you take people to be rehabilitated and they will stay at lean for some few months or a year, and then, but again they relapse. So what is happening is the rehabilitation centers, they are good, they're doing their work, but they are not enough. We need more in South Africa. And again, we need a aftercare service that will make sure that these people, they are kept clean. Thank you.
One of the challenges facing the country is the lack of comprehensive national statistics. Statistics on the prevalence of substance and drug abuse. How can the Central Drug Authority play a role in this regard?
CAD, as I was talking about the reporting system, it needs to have the reports, encourage for reports from the locals and the provincial, and have on that reports, the stats, we should have a column for the stats of what is happening around South Africa in terms of the abuse of the substance and drugs. So the CAD should make it a baby that from time to time in each meeting that they are having, they must have the stats so that they would be glued up. And that's, thank you.
Next question, Member Stock.
Thank you very much, Matema. Recently, there's been much debate in the country around the recent court judgment on the decriminalization of marijuana, cannabis. So I would like you to share what is your opinion regarding that court judgment on the decriminalization of marijuana for personal use? Thanks.
Okay, you may repeat.
Recently, there's a court judgment on the decriminalization of the use of, for personal use for marijuana, weed, or cannabis. So I would like you to share your opinion with the panel. What is your opinion regarding that court judgment? Thanks.
Okay, thank you. The report has shown that there are some sicknesses that can be cured by marijuana. The report has shown that some people, they are taking it for religious purposes. My opinion is that it's fine that it can be used for such purposes, which will benefit the person who's using it positively. But the thing is, the particular person, or there should be some regulations, or there should be some letters or a certificate that will authenticate the use to that, the use for that particular person who's using it. Thank you.
Thank you. During the COVID-19 pandemic, government introduced a number of lockdown regulations to deal with the spread and to contain the spread of the virus. And now I want you to be more specific in your response. There's lockdown regulations which were introduced by government regarding the sale, the ban on the sale of alcohol and tobacco. So please be more specific in your response. Your focus should be on the sale of alcohol. So I want you to advise the panel, if you had to advise government how to deal with the sale of alcohol during a pandemic in the future, if it will exist or if it still persists, what would be your advice to government? And then you've got 3 minutes. Thanks.
My advice, personally, I would say it was good that it was said that it was banned for that period of lockdown. But unfortunately, as it has been said, that it affected the economy of our country. But as it was banned for that period, I think that the rates of gender-based violence, domestic violence went down, and any other social ills were down, the rates were down by that time. But unfortunately that when we having this, the unbanning of the alcohol, it went up again. But however, it's two sides of a coin, because if we say we ban it and now our economy goes down. I thank you.
Thank you very much, Ms. Tema. Is there anything that you would like to ask the panel or to make a comment?
Thank you, Chairperson, and I just want to thank the members of the panel for giving me this opportunity to come here for an interview. I thank you. I just want to make a recommendation that the mainstream, the CDA, should make sure that the mainstreaming of the substance and drug abuse should be on the IDPs of the municipalities. Because why am I saying this? As a person who's coming from a local drug action committees, you would expect that the municipality should spearhead according to the drug master plan, according to the act, that the mayor should be the one who is running forward with the national drug master plan, or chairs the committee, the local committee. But when you go to municipality, you find out that there is non-existence of the LDACA. So if the CDAs can just make sure that all the municipalities, they have the committees and the political parties, they are hands-on on this committee, I think we will be able to conquer or to achieve the goal according to the act. Because if we don't have their buy-ins, there's nothing that we are able to achieve. So we are failing because of the buy-in of our political leaders.
Thank you, Ms. Tima. We will really look into that. Members, our next candidate will be Ms. Vermeulen from Gauteng Province. Let's just take a 5-minute comfort. Good morning, Ms. Vermeulen. Is it Miss Vermeulen? Mrs. Vermeulen from Gauteng. Let me start by introducing myself, and then the rest of the panel will introduce them. My name is Marinsha Gillian, chairperson of the subcommittee for this interviews for this morning. Member Stock.
Good morning, Mrs. Vermeulen. My name is Dikhang Stock. I'm a member of the Portfolio Committee on Social Development, as well as a member of the subcommittee dealing with the interviews. Thanks.
Good morning, Mrs. Vermeulen. My name is Bridget Masango. I am a member of the Portfolio Committee on Social Development and the member of this subcommittee. Welcome.
Morning, Ms. Vermeulen. I'm Letitia Aris, member of the Portfolio on Social Development. Welcome.
Good morning, Ms. Vermeulen. I'm Dalmaine Christians. I'm a member of the Select Committee of the Social Cluster and also of this committee.
Good morning, my name is Otomadika. I'm a member of Select Committee and the subcommittee. Thank you.
Thank you, members. Mrs. Vermeulen, welcome, relax, take a deep breath. If you need some water, take your water. Tell us a bit about yourself and why are you interested in committing your time and energy to serve on the CDA board, and also, if appointed, what will you bring into the work of the CDA? Thank you.
Thank you. Thank you, Madam Chair, and thank you for this great opportunity. I really am grateful to meet you. I feel like I'm sitting with my back to everybody else, so I just want to say good morning to everyone. So my name is Audrey Vermeulen. I'm a social worker by profession. I studied at UJ many years ago, and then I finished my master's degree at Wits University. And I have been working in the substance use disorder field for going on 26 years now. So I always say that you either love this field or you don't like it at all. So for me, I love this field. I've got a passion for what I do. And I've been very fortunate that through the years, I've had many exposure to different kinds of treatment settings. So I've worked in an inpatient treatment facility. I've worked in outpatients, community-based. And then I've also, since for the last 4 years, I've been working at the Sanka National Office. So I'm situated in Lyndhurst, and I'm the national coordinator for the organization. And our main aim is to do prevention and treatment of substance use disorders. And we also, as the main overseeing organization, we've got 31 members of the treatment facilities. That's part of our structure. So we just came from our very big meeting yesterday as well, our biannual assembly. and we're looking forward to be part of the CDA, and there's many reasons for that. We've been represented before also by two previous members, Mrs. Carol de Tooy and then Mr. Gert Kruger. But unfortunately, Mr. Kruger is resigned. He's resigned from the CDA, and he's retiring. Actually, he's looking forward to have spent time with his grandchildren. And so yes. But our main aim for definitely from my side, I want to be part of the CDA because I do believe that as a national organization, we can look at policy development, we can assist in strengthening what the CDA is trying to achieve through the National Drug Master Plan. So from our side, I feel that it will also assist our organization as well to make sure that we are doing what we are supposed to do and in line with that.
Thank you very much. Can we move to question number?
The mic. Thank you, Ms. Vermeulen. The Central Drug Authority was established by an Act of Parliament. Which act is that, and what does the act seeks to achieve? You have 5 minutes to answer this question.
Thank you very much for that question. The CDA is, the whole strategy started with the Substance Abuse Act 70 of 2008, and that is where the CDA is described and the roles and responsibilities is described in the Act. We've also been instrumental in providing inputs in the new proposed policy that is on the table as well, to look at how should it be structured and how we should also look at other aspects of the Act as well. So the whole Act is not only around the CDA, but it also looks at registration of treatment facilities. It looks at community-based, inpatient and outpatient-based facilities and what they should do. It also looks very much on what I'm interested in as a social worker, is looking at voluntary and involuntary admissions of clients and how to assist clients to access treatment and how to make sure that they get the help that they need. So from the CDA's point of view in the Act, it's very clear that the CDA is responsible for the strategy, the overall strategy of the National Drug Master Plan, and that is our blueprint as a country in terms of what we like to achieve, and how do we like to address this pandemic that we are facing as a society. Oh, sorry.
Thank you. Don't worry. In your own assessment, do you think that the CDAs perform its mandate efficiently? If yes, how so? And if not, what is the shortcomings? Then you can highlight both with regards to the mandate as well as ensuring compliance, accountability and monitoring, development and implementation of the department's drug master plan by national and provincial drug master plans by provincial forums. And how are you propose to address these shortcomings?
That's a long mouthful. I'll try and help. Yes, I do. I think there's more than one question in there. If I can start with the CDA, your first part of the question was how effective. Let's break it up. Thank you. I will answer now, Madam Chair. I just want my pen. So From my personal view, I believe that the CDA partially achieved what they are meant to do. Unfortunately, we didn't see the reduction in substance use disorder in our country, and I think that was part of trying to see how do we minimize that. I do think also the National Drug Master Plan came out very late. You know, it didn't meet its deadlines and its targets, and it didn't have an implementation plan as part of the previous one. So I'm glad to see that that is now changed in the new one that we have, and that makes it a lot easier to monitor and to evaluate the achievements of the CDA. But I do believe that timing was an issue, you know, that there was a lot of concerns raised, and I do realize that there probably was a lot of debates, but looking as an outsider, we didn't know what was the delay or what was the whole concerns around why the National Drug Master Plan was delayed. Also, I think there's a shortcoming in terms of the local drug action committees from my side. I don't believe that they are functioning as well as they should be on ground level, and that it's because in the Act it's now allocated to the municipalities, you know, and they are supposed to oversee the local drug action committees, and that's not happening the way it's supposed to. So from my side, I feel there's a gap, you know, in terms of getting the community involved in resolving the issues around substance use disorder, and really who knows best than the members of that community? What are their challenges? What do they go through? And how to deal with it most effectively. How I can fix it, I think, was part of your... I think it's all, thank you, in terms of, so I think already the implementation plan helps to monitor the progress made from the CDA side, and one can then be more accountable, I think, as a committee to communities, you know, to really say this is what's been achieved. And I think that is a great improvement from the last National Drug Master Plan that we've seen. I do believe with the local drug action committees, what I can propose is that we look at other models that's used in other countries as well that could be effective in strengthening the LDACs. The LDACs are merely a structure at this point, in my opinion, and I believe they don't have actual tools, or they don't have techniques, and so that is what I think of. We make use of a model called CATCA, the Coalition for Anti-Drugs in Communities, and the CATCA model could be joined with the LDAC, and it will strengthen the LDAC because it gives them the tools. It gives them the ability to do a community survey to see where are the hot spots, where are the areas they need to focus on, but it also gives them that intersectorial collaboration, because at least 12 sectors must be represented on a CATCA, a coalition. And so I believe that one can strengthen the LDACs. A lot of work needs to be done there, but that is how we're going to address substance use disorders, not by treatment only, because treatment is putting a band-aid on the issue for me. You know, it's really going back to our families, our communities, and how do we address it on that level and mobilize our communities and strengthen them.
Mrs. Vermeulen, the National Drug Master Plan 2019-2024 represents a multi-sectoral approach to create a South Africa free from the harms associated with drug use, drug misuse, and drug abuse. The plan observes national and international policies, conventions, plans to ensure respect and dignity for all the people of South Africa. So if you are appointed as a member of the board of the CDA, you will be expected to implement the authority's mandate. So if you could please share with the panel your understanding of the objectives of the National Drug Master Plan 2019-2024 and how you think the CDA should achieve these objectives. Thanks.
Thank you for that question. I think that collaboration is a very important part of the CDA's function that they need to do. But looking at the overall principles, there's the underlying principles, which I think is wonderful, that's been added to the National Drug Master Plan, and that is to really look at that multi-sectoral approach where everybody works together and we have a common goal together and achieving that together. So I believe that is one of them. And then putting people first, for me, that's also very important from the principal side, to really look at the needs of our service users and really how do we meet those needs, and not only look at it from what we think as professionals should be done, you know, but also getting them to be part of this and to participate and to be included. So looking at the overall objectives, we're looking at demand reduction strategies that needs to be focused on as one of the objectives of the CDA. And I think a lot can be done for prevention, especially. There's another gap for me, you know, that we haven't really focused a lot of our attention on prevention services, and that's really the core of demand reduction for me. So from a CDA point of view, I would like to see that strengthened and that we see prevention as a science, you know, and we understand that the impact of prevention programs also need to be measured so that we are able to make sure that when we do get international parties or relationships going, we can understand that our work is worthwhile and we do have an impact in reducing the harms caused. We also have a big part of the demand reduction is also treatment, you know, so that's the other part of it, and looking at the continuum of care and making sure that over that continuum of care, people have access to treatment, people are able to complete treatment services. Very important for me is the aftercare component that's neglected, you know, so I do believe that aftercare is the answer to successful treatment, and that should be also strengthened, and that is part of what is also the CDA's mandate as well, to look at that continuum of care and how to make sure there's effective demand reduction. We also, there's also the supply reduction section of the objectives, and that is to look at law enforcement and their role that they play in making sure that there's none of the products available to our communities and our youth, especially our children. So for me, that's a very big part. Some of the others that I think, then what's added for me in this one is some of the needle exchange, OST programs that have been introduced, and that is another form of treatment and really meeting people where they are at, you know, where they are still using the substances.
The plan, as I mentioned earlier, also speaks to South Africa being a signatory of international conventions. How, in your view, would that particular aspect of the plan improve or help in CDA being able to achieve the objectives of the plan?
There is definitely a lot of treaties that our country signed, and it goes back to 1960 odd, I think. So we've signed on different levels that we as a country will look at fighting against illicit drug use specifically, and that's why we've got 26th of June where we celebrate that as a country. I think that we need to look at our international partnerships there, the United Nations. We need to look at how do we stay involved there, how do we learn from other countries in terms of what strategies have worked for them, and it's really about sharing of experiences and what can work. And I also believe that the African Union can be assistance as well, that we look as not only we're looking always at America or UK, but we need to look at African solutions, you know, so looking at the AU and what other countries in Africa is doing regarding this. We can learn a lot from countries like Kenya, for instance, Mauritius as well, so they've got very good strategies that they have implemented. So I believe it's again about being present on those platforms as the CDA and being the voice for our communities, you know, because that's what I feel is the role of the CDA, is talking for the people that can't talk for themselves.
Prior to the review of the National Drug Master Plan 2013-2017, a need to conduct an evaluation was prioritized to assess how it was implemented. And subsequent to that, the Department of Planning, Monitoring and Evaluation, in partnership with the Department of Social Development, commissioned an evaluation of NDMP 2013-2017. So the question would be, what were the key findings and recommendations of that implementation evaluation?
I'm going to go on memory. Please forgive me if I forget some of them. But one of the most important parts was that there was no implementation plan, you know, to measure the progress that was made. So that was one of the key recommendations. They were also looking at getting all the stakeholders involved and really giving everybody their roles and duties to be described more effectively. I can look at my document, can I? To look at but those were some of the ones that I remember from reading the document. And we didn't include people using, you know, so we never asked them what they would like to see in a document like this. So that was also part of it. Thank you.
Thank you. Question number 4.
Thank you, Chair. What is your understanding of good governance, including its main features, and how would you ensure good governance in the CDA?
Thank you for that question. That's a very big task to do. But I think the governance of the CDA, it's to do with leadership and making sure that everybody understands their roles, responsibilities, what is expected of them. So I do believe that that is part of good governance, is to do that. And there's always, with governance, there's always challenges, you know, so one needs to look at how to resolve challenges, how do one address that as a committee together. But I think it starts with a commitment from the members to make sure that everybody on that committee is dedicated, committed to what needs to be achieved, but there must be good leadership. You know, so it starts with the leadership for me, and one needs to make sure that this leadership is aware of their roles, the responsibilities, they know what they can do and can't do, so it's very clear on conduct as well, you know, that you look at that as well. Other parts of it is to do with the administration part of it, making sure meetings are run, that you have regular inputs from everybody, and that you are able to make decisions, you know, and have a solid foundation to make decisions from. I don't know if there's a constitution of the CDA, how it's structured, but I suppose that guides you as well in terms of how the meetings should be run, how often it should be compiled, and how the administration works of these meetings.
Are you finished? Thank you. Can we move to question? Can we move to question 5.1?
Thanks, Chairperson. Mrs. Vermeulen, what are the key issues affecting young people, their families and communities regarding substance abuse? And how would you advise the government to deal with these issues? You have 3 minutes.
Thank you for that question. Good. So how much time do we have for this question? 3 minutes. Right, from my side, I believe that the youth are severely affected. If we look at our Sekendo statistics, we see that it mainly affects our youth. And that has got to do with many social issues that we are currently experiencing as a country, high unemployment rates, severe poverty that we are seeing. We're also looking at family structures really becoming dysfunctional at times, and children having to navigate through very difficult times on finding themselves and really finding what they need in life. A very big, what I've seen with the youth, in my opinion, is that they've lost hope for the future. You know, they don't see a future for themselves. They don't see any prospects, you know, or any opportunities for them. So I think that has created for a gap for me with some of the youth, that they don't feel they know where they belong in our society. So I would recommend that we involve youth a lot more in campaigns, in the CDA even, you know, that we have a youth portfolio, that we really make sure that the youth have a platform as well, and that we need answers from the youth. You know, we are all adults in this room, and we can't possibly know what's going to work for them. And we know that technology is a great way to reach the youth, to communicate with them, and we need to find ways to really communicate with our youth. The old techniques don't work, you know, the old strategies we've tried doesn't work anymore. We need to get the language that they understand, you know, and that is what I would recommend to government, is that we need to involve youth more, we need to get them involved in programs and looking at solutions going forward. And that is a big task to do, you know, because I think we have to look at our local drug action committees as well. How can they be capacitated to do that and really involve them, you know, also at that level.
Thank you. Question 5.2.
Thank you, Chair. In your opinion, what is the state of public rehabilitation centers in the country? Are there any challenges with regard to access to public rehab centers in South Africa? If yes, what are those challenges, and how would you advise the country to address those challenges?
I just wanted to clarify the first part of your question, please.
What is the state of public rehab center in the country? Are there any challenges with regard to access to public rehab center in South Africa?
Thank you for that question. I want to say that the National Department of Social Development has come a long way in making sure that we do have now facilities in every province, which we didn't have before, you know, so we do see that as a great achievement, you know, that we do now have facilities. Some of the challenges we are faced with in some of these public centers are still that we have capacity building of staff is needed, you know, the staff is not always trained, and this is a specialized field. So for me, the capacity building is a big concern, and there are national treatment programs, but I don't think they are always utilized to the best of their capability. So I believe it's got to do with the staff and capacity building of the staff at these centers. Also, another problem is that we look at the needs of the client, and if everybody thinks that you need to go into an inpatient facility to get help, but you can also do it on an outpatient facility depending on your stage of dependency. So for me, I think we still have a long way to go with assessment and sending people to the right treatment centers and getting the right help for them, you know. So it doesn't help you putting a child that's experimenting with cannabis with somebody who's using heroin or Niobe, because now you're exposing that child to to another form. You know, they learn a lot more in that center, and they shouldn't be learning that. You know, now they know where's the best heroin to buy or nayopi to get, how to use it. So we have to be looking at our capacity building of our staff at these centers, and let them really understand that this is addiction is a science, there's evidence for it, and it's a disease, you know. So there, I think we still need to do a lot more work. And then definitely looking at some of the other challenges are that the security at some of these facilities needs to be looked at. You have a lot of people in the centers, and sometimes there's things that happen that shouldn't be happening, so I believe one needs to look at that as well. So that will be my recommendation, is to focus on capacity building of staff and looking at treatment programs that's effective and evidence-based.
Thank you, Member Aris.
Thank you. Mrs. Vermeulen, one of the challenges facing the country is the lack of a comprehensive national statistics on the prevalence of substance and drug abuse. How can the Central Drug Authority play a role in this regard?
I agree with you completely that we do not know the extent of the problem in our country. The only statistics we do have available is on Sekendu, and that's mainly treatment data, so it doesn't show us any data in regards to how many people are actually physically using. So my recommendation to the CDA would be that we need to do a national household survey. And that is done in other countries as well, where we really then ask people questions around their relationship with substances, and that will give us more accurate statistics around what we are dealing with, the extent of the problem in our country, and how to tackle that. So I also believe that we do need a centralized data system in the country, and that is not there currently. And we need to capture all the relevant data from all the different all the different Department of Social Development stats from the different provinces. That needs to be all in a central system, and we don't have that at present moment to really see what is the full picture. So that will be my two recommendations.
Thank you, Member Stock.
Thank you very much. Good afternoon or good morning, Ms. Vermeulen. It's still morning, okay. Now, recently there's been a debate in the public discourse regarding the court judgment on the decriminalization of marijuana, cannabis for personal use. So I would like you to share your opinion with the panel regarding that court judgment. Thanks.
Thank you for that question. If you're asking me as a person, I was devastated by the outcome of the court case. As a mother, you know, as well, I'm worried about my child and his future. So on a personal level, it wasn't a good day for me that day. So I think that I understand the decriminalization of cannabis quite well, that it is about making sure people have access to treatment rather than let them have a criminal record. So I'm in agreement with that completely. But I think it was people now in the public domain believe that they can now use it the way they want to without the consequences, and that sent out the wrong message for me. You know, that cannabis is still safe, there's no harms to it, and coming from a treatment point of view for so many years, I've seen the opposite of that, you know. So in terms of what I've seen in the centers is that that's where the problem starts. Actually, it starts with tobacco first and alcohol, and then you move on to cannabis and then exploring other substances. So for me, it was it wasn't, that ruling was upsetting as an individual, and how do I protect my child from this? But on the other hand, as a professional, I realized why this judgment came through, and it was based on people's, their rights, their rights to make decisions about what they put in their body, and so on. But we have a responsibility to our children still to protect them, from that as well, because they're underage, and cannabis affects the development of the brain as well. And we know that the brain is so complex, and that adding cannabis to it affects this developing brains of our children, So I'm quite concerned about that. I think that this is the first step in decriminalizing all drugs, So if I could have a crystal ball, to think that there's a movement towards decriminalizing everything, and the next day you could see that it was also economically driven, the whole court case as well from my side.
Thank you. During the COVID-19 pandemic, government introduced a number of lockdown regulations to deal with the spread of the virus or to contain the virus. Now, I want us to be more specific in your response. The introduction of the lockdown regulation on the sale of alcohol and tobacco. So I want you, in your response, you must focus more on the tobacco ban, the lockdown regulation which was introduced regarding that. So if you were to advise government how to deal with the sale of tobacco during a lockdown regulation, during a pandemic, if it persists in the future, what would be your advice? Thanks.
Thank you, sir. You want me just to comment on tobacco, not alcohol as well? Wonderful, thank you. I think this is what we as SANCO have been busy with since the lockdown, is really talking to media also about the ban and how that has affected treatment and how it's affected our clients. So from my side, the sale on alcohol, we support that, and tobacco, because we knew that this is part of the Disaster Management Act, and that it's about keeping our people healthy, and really protecting them from that side. And so from my side, I support what was done, and I think that we could have done it a little bit differently in terms of creating more public awareness around why the decision was taken, and also allowing more leniency, in terms of some of the stricter parts of it. If you look at lockdown 5 and 4, where people were arrested and so on. So looking at that, I feel that we could have done more public awareness around why this was done, So, and also to prepare us for this, it wasn't, none of the people were prepared for it. Even our people that are chronic users, they weren't prepared for the lockdown as well. Otherwise, they would have been able to, in advance, seek treatment or to reduce the intake of what they've taken. And the opposite of this, unfortunately, had a negative spin-off, that we saw people drinking sanitizers and being admitted to hospital because they were so desperate for alcohol. People reverted to brewing their own concoctions at home, which is dangerous, and we've seen deaths with people doing that. And also you saw people illegally buying alcohol, and so it really didn't send out the right message. So I think it's got to do with how we communicate with the public and what messages we send to them of why we're doing this. The same with tobacco. The same happened there, where people were selling tobacco products at 3 times the price, so, and people can't just stop. And there's no formal cessation programs available. So we must make sure that there are things people can fall back on, if they do have to quit nicotine, that we did have programs in place for them to do so. Thank you.
Thank you for for honoring this interview. Is there anything that you want to ask the panel, or any statement or something that you want to say?
Thank you, Madam Chair. I just want to say I'm so grateful for this opportunity, and just talking to you is already for me an advantage, you know, to really talk about my opinions and what I think could be possible solutions going forward. So I just want to thank this panel as well for a great opportunity. Thank you.
We can excuse you. Just before you go, can you inform the members about the situation of the Free State candidates, please?
Good morning, members, everyone. The Free State candidates were taken off their plane this morning at 9 o'clock. There's 2 of them. We have made a swap in terms of allowing them time to travel still, so we have another candidate. Unfortunately, they are waiting on a plane from Johannesburg, and they were told that they would be flying at 12 o'clock. So our intention is to have our lunch hour at 12 o'clock and give them time to come in. Thank you, members.
While they are busy preparing and cleaning for the next candidate, take 5 minutes break, and then just at 12 o'clock then, we will have lunch. We will continue with the next candidate from Gauteng after 5 minutes. 12 o'clock we will break for lunch, and when we come back for lunch, hopefully the candidates of Free State are here. Thank you. Members, just to draw your attention before we get the next candidate. If the candidates from Free State is going to fly from Joburg at 12 o'clock, if they manage to fly from Joburg at 12 o'clock, they will be here at 2:30 landing, which means they will be here by 3. So, which then means that from 12 o'clock after this candidate, we will have a free lunch for 3 hours. Okay? So you can, okay. But our next candidate is here. Marcel, you can bring him in. Let's discuss it after this interview. Let's discuss it after this one.
Can you switch it off?
Members, our next candidate is Mr. Peter Uko from Gauteng Province. Welcome. Mr. Uko, my name is Marinsha Gillian. I'm the chairperson of this panel. And I would ask the members of the panel to introduce themselves.
Good morning, Mr. Ugo. My name is Dikgang Stock. I'm a member of the Portfolio Committee on Social Development, also a member of the subcommittee dealing with the interviews. Thanks.
Good morning, Mr. Uko. My name is Bridget Masango. I'm the member of the Portfolio Committee on Social Development and a member of the subcommittee. You are welcome.
Welcome, Mr. Uko. I'm Delmaine Christians. I'm a member of the Select Committee for the Social Cluster, as well as for the subcommittee.
Good morning. My name is Audrey Malika, a member of Select Committee and the subcommittee.
Just waiting on Member Aris to introduce herself.
My humble apologies. Morning, I'm Letitia Aris, member of the Portfolio Social Development. Welcome. Sorry for the delay.
For this interview, and can you tell us a bit about yourself and why are you interested in committing your time and energy to serve on the CDA board? And then if you are appointed, what will you bring into the work of the CDA? And if you feel comfortable, you can remove your mask.
Thank you, Madam Chair. Yes, I feel more comfortable without the mask so that I can speak well, and I feel safe with the distances that we have, and appreciate your invitation to come here. Thank you. My details are mostly on my CV. I have the necessary experience going back for decades in local government with governance. I have qualifications in language from Wits University, as well as international qualifications in language from Intersol in the United Kingdom. I have legal qualifications from UNISA in provincial and local government law and constitutional law. I'm a member, so I understand law and am familiar with the application of law and indeed the drafting of legislation. I'm a member of the International Police Association, so I have enforcement knowledge and experience. And I'm a member of the International Society for Substance Use Professionals. There are a few other things, but I think that's enough to indicate that I have the experience and the qualifications. What will I bring to the table? Apart from knowledge and experience, because I've served on the board now for 7 years, I know how it works. Particularly, I know the shortcomings, Madam Chair, and I believe that I know how to overcome those shortcomings. What that depends on is the other members of the board. If we have strong members, then we can make progress. What do I bring to the table? My desire to save life. That's my principal objective for doing most of the things that I do with my community work and my work in public health, is to save life. And life means to save lives, to save individuals, to save families, and to save the environment. The most important thing that I bring to the table and to the committee, and that I will continue to expose all the time, is passion. I don't think there's any question about my passion to save life.
Thank you, Mr. Uko. Can I ask Member Aris, are you ready?
Mr. Unka, am I pronouncing this name right? Unka. The Central Drug Authority was established by an Act of Parliament. Which act is that, and what does the act seek to achieve? You have 5 minutes to answer this.
Thank you, Madam MP. The Act is the Prevention and Treatment of Substance Abuse Act. It's number 70 of 2008, although it only came into force when it was promulgated on the 21st of April 2009. To see what this Act seeks to achieve, one would first look at the preamble, and the preamble talks about the international global problem of substance abuse and the growing problem of substance abuse in South Africa. And then mainly it talks about the dealing with substance users, their treatment and their reintegration into society. That's in the preamble. The Act itself in Section 53 establishes the Central Drug Authority and has some rules of that. Under Section 54, it establishes the Executive Committee, and there are some rules that it must be not less than 7, but not more than 10 members. Very importantly, Section 55 establishes a secretariat, and the secretariat is required to support the work of the Central Drug Authority, and indeed it says that it must support the work and all incidental matters as required by the Central Drug Authority. And I say as required by the Central Drug Authority with emphasis, because that's one of the huge problems that the Central Drug Authority has had, is that the administration which is there to support it does not entirely support it. In fact, they often oppose it. So when we get to the next term, if I'm there, I will ensure that we get better support and therefore better results from the Central Drug Authority. There are some other statements regarding the work of the Central Drug Authority and some rules in the Act. Essentially, that is it.
Thank you. My other question to you, in your own assessment, do you think that the CDA performed its mandate efficiently? If yes, how so? And if not, what are the shortcomings? You can highlight both with regards to its mandate, as well as ensuring compliance, accountability, and monitoring, development, and implementation of the department's drug master plan by national and provincial drug master plans by provincial forums. How are you proposing to address these shortcomings?
You have 8 minutes.
I beg your pardon?
You've got 8 minutes in this conversation.
Thank you, Madam Chair. I don't have a clock, so you'll have to guide me. The answer to the first question, because there are many questions there, is that the Central Drug Authority is both successful in some areas and largely unsuccessful in other areas. I would believe that this committee understands that we are less successful than in actual fact we really are, and I can explain that. We are required to do many things. One of them is an annual report. The Act requires us to submit that report to the Minister no later than the last day of August in every year. And largely, we've managed to achieve that. Once or twice, we've done it in September, but largely we achieve that. But you don't know that as a committee. What happens is that the annual report gets held up in the system by the administration. And it might take 2 or 3 months even to get to the minister. And then the minister might take 2 or 3 or 4 months to submit it to this committee. So this committee thinks that we are 6 or 7 or 8 months late, whereas in fact we've been on time. The Act requires the minister to submit it to Parliament within 14 days. Unfortunately, that doesn't happen and we have no control over it. How to improve that? One of the things that I can do is advise this committee every year. I'm prepared to do it every quarter about what our progress is, but every year send an email to all the members of the committee and through the chairman, a notification saying our annual report has been submitted. And then you know that it's been submitted, and every hold-up after that is out of our hands. And it all indicates that the Central Drug Authority requires more independence and being taken out of the Department of Social Development. There's no question about that whatsoever. As far as implementation is concerned, we need to liaise more with departments. And therein lies another problem with us lying administratively within the Department of Social Development. When we write to representatives of the departments on the committee or to the Central Drug Authority, the line of communication should be from the DG of the Department of Social Development to other DGs. It doesn't lie within the hands of the representative. They just come and report to the Central Drug Authority. So when we say write a letter and tell them it's a deadline for the report on this date, the letter goes out to the representatives. But the department administrative staff know that it should go to the DG and ask our DG to write to other DGs, because it's the DGs and the ministers who are responsible ultimately. So that's a line of communication that we would have to follow and ensure that it gets followed. But once it leaves the Central Drug Authority, it's in the administrative hands, and we don't have any control over that. I believe, however, that the current Director General, Linton Mqunu, is more favorable to the activities of the Central Drug Authority and is much more likely to ensure that the support that we need is in fact given to us. I can emphasize, for example, the fact that there's a lack of support, and has been for years, in, for example, what's happened today. I was told last night by a member of the current board who was on the shortlist that she's withdrawn. Now, you should ask yourself why she withdrew. And the reason is that she doesn't want to continue to be abused and bullied and exploited by the departmental staff, because that's what happens. I can deal with that in the future. The chairman has the same views, and I'm sure he's expressed this to you in certain meetings. He certainly expressed it in the last meeting of the Executive Committee. So we will overcome those shortcomings, certainly with the help of the Director General. Have I answered fully, or is there another element? Because there were many questions which you asked, Madam MP.
I was asking in terms of compliance, accountability, monitoring, development and implementation. And then in terms of the shortcomings. Yeah.
As I mentioned, Madam MP, the requirement and the responsibility comes from the Minister and the Director Generals of various departments. We know from the last assessment of the Department of Monitoring and Evaluation that only 3 departments at that time, and I think that was in 2015, only 3 departments had their own departmental mini drug master plans. And that's because the responsibility hasn't been placed on the DGs and the MPs by the Central Drug Authority via the administration. And I think we can do that. If the lines of communication are right, then the departments will have it. And if we liaise with them more appropriately and more thoroughly, as we are required to do, without restrictions from the administration, then we will achieve more success on implementation at grassroots level. The Central Drug Authority itself doesn't work at grassroots level, but through the departments and through the provinces is where we get to the grassroots level with provincial drug active forums and with local drug action committees. That needs to receive more attention, and it will do.
Sorry. Do you think, just share with us your view in terms of what you think the powers of the CDA, is the powers of the CDA sufficient, or what do you think?
Unquestionably, no, they are not sufficient. The CDA is limited and hampered by its placement within the Department of Social Development. And I'll give you another example. We have rules of governance which were published in the Government Gazette in 2007. Very shortly after we took office, we realized that the rules of governance need to be changed and improved so that there was more clarity as to how we would work and what we would do, what constitutes a quorum, how voting would take place, all the small mundane issues of management and administration to make an organization successful. We drafted those rules, and from approximately 2018, I think, we kept asking for those rules to be brought to the Executive Committee and to the Central Drug Authority so that we could finalize them and approve them and have them published in the Government Gazette, because that's what has to be done to make them official. Those rules were never presented to us. Okay, may I just finish that comment? They were never presented to us, and we found out only this month that the chief director said that they should be held over until the new act is promulgated. And that's not his duty, it's our duty, and it should have been brought back to us. But again, we were hampered.
Next question.
Thank you, Chair. Mr. Uko, the National Drug Master Plan 2019-2024 represents a multi-sectoral approach to create a South Africa free from the harms associated with drug use, drug misuse, drug abuse. The plan observes national and international plans and conventions to ensure respect and dignity of all the people of this country. So if you are appointed as a member of the authority, you will be expected to implement the authority's mandate. Now, what I would like you to share with the committee is, with the panel rather, is your understanding of the objectives of the National Drug Master Plan 2019-2024 and how you think the CDA should achieve those objectives. You have 8 minutes to discuss that.
Thank you, Madam Chair. First of all, the National Drug Master Plan, which we have now, is a huge departure from the past concepts of National Drug Master Plan. It deals, of course, as required in the Act, with harm reduction, demand reduction, and supply reduction. And within the Act is mentioned prevention. I believe that the larger key lies in prevention, because if we prevent, imagine utopia, if we prevented every single person from starting to use drugs and got the current users to stop, then we had no need for harm reduction, demand reduction, or supply reduction, because if nobody's taking drugs, that would be utopia. So I believe that the key is in preventative programs. The way that that needs to be done is, again, to liaise with all the other departments, and they're all important: sport and recreation, arts and culture, certainly education at all levels, because we ask ourselves, why do people start taking drugs? People of all ages. It's because in the youth, lack of activity, lack of things to keep them busy, lack of things to keep them interested, and lack of things to keep them excited. If we involve arts and culture and we have drama schools and singing classes, dancing lessons, they'll have activities to keep them interested and inspired to do more and to grow, and they're less likely to get onto drugs. It's the same with adults. If they have activities to keep them busy, hobbies, whatever it is, sport is also the same thing in arts and culture and activities and acting, playing sport, participating in sport, being a fan of sport, something that keeps adults busy. It's the family problems and the stress of society and the stress of living that gets people into the use of drugs. Excessive use and abuse of drugs that disturb their minds and disturb the balance in their psyche. So we need to address all those other issues by liaising with all those departments so we can introduce those programs. It requires talking, first of all, to the DGs, and to get in each department a team who's prepared to work. It requires talking to the provinces, and particularly, the Act requires that mayors in cities establish local drug action committees. That's where it starts to help at the grassroots. If we can do that and liaise with mayors, then we can increase. The audit of the local drug action committees was abominable. There are many towns that don't have any. There are many provinces that don't have any. And it's sad that that is the case, because that's where the connection with the community takes place. So we would have to liaise with mayors of all the towns and the cities, and probably do that through SALGA and other, that's the Local Government Association, the link to get them to fund those mandates, because the cities say that they don't have any funds, but the local drug action committees do need to have those funds. Have I covered all of that? Because there is more that we can do and go into. This current National Drug Master Plan is certainly more implementable than in the past. It has a much more human rights approach. The old school of punitive action against abusers and users of drugs has been replaced by a human rights approach, by recognizing that the users of drugs are there for a reason, that addiction is not, oh, you're a bad boy, you're an addict, you're a cokehead. That's not the current approach. It's recognized that addiction is a disease of the brain, a chronic disease of the brain, which is treatable but not curable. And if we approach it from that point of view, then we have a much better chance of getting a result. Less punitive approach. If you look at the statistics, in crime and violence against women and rape and those sort of things, the conviction rate is about 3% or something. It's dreadfully low. The conviction rate in drug offenses is about 47%. And it's because it's an easy target for the police. Some guy's an addict, and so you catch him with a drug and you incarcerate him. We need rather to treat them and to reintegrate them into society. That would be the better approach. And then we can focus energies of law enforcement onto gender-based violence and rape of children, abuse of children, human trafficking, all the important things that we have to do, which will free the law enforcement authorities when we deal with the drug problem.
Mr. Uko, the plan also observes international conventions, and I would like you to share with us how you think that observation of international conventions would help the CDA to actually implement the mandate of the plan.
Well, certainly there are organizations like UNGAS and UNIDOC, which is the United Nations Office on Drugs and Crime. They have a lot of statistics and information and the ability to support what the Central Drug Authority does. And we can do with their support, and we can use their support. There's also UNIDOC's report, the World Drug Report of 2020, has a lot of information in it on statistics and how we can use. If you read the executive summary, the report, Madam Chair, by the way, comes in 6 volumes plus 2 annexures. The first volume is the executive summary, which really outlines what and how we can do. And we can go into details of that, and particularly why it must be done. The other 5 documents deal with the supply of drugs and the routing. And Africa, South Africa particularly, has become a point of manufacturing and transit for drugs to other countries and use. Our use is growing exponentially. It's quite disheartening, in fact. There's another volume which deals with treatment and the users of reintegration into society and other matters related to drug use and substance abuse. The last is an annexure with a lot of information about sources and 1 volume with data. Data is important so that we can look at the data, particularly to South Africa, and know that we can apply that in South Africa in order to save lives.
Right. The next question speaks to the previous master plan, which is 2013-2017. There was a need to conduct an evaluation that was prioritized to assess how it was implemented. And subsequent to that, the Department of Planning, Monitoring and Evaluation, in partnership with the Department of Social Development, commissioned an evaluation of the implementation of a National Drug Master Plan 2013-2017, which took place in August 2015 and January 2016. So the question would be, what were the key findings of that evaluation, of that implementation evaluation, and the recommendations, as it were?
Thank you, Madam MP. Yes, Madam Chair. We participated in that actively. The Department of Monitoring and Evaluation really did a fine job in looking at all the presentations that we made to them and other departments. The key findings were several. The one is that the National Drug Master Plan at that time was too high level and had too few areas that were easy and possible to implement. So the implementation possibilities of the National Drug Master Plan were too high level. It found that provinces were not sufficiently involved with their own provincial mini-drug master plans, and certainly, as I mentioned earlier, only 3 departments had their own drug master plans for those departments. We need to make sure that every department has it and is committed to it. We need that commitment, and as I mentioned earlier, the passion. There were 3 findings or recommendations. Those were the findings that I've just mentioned. Inter alia, that it was not implementable and that the departments didn't have their own plans. The recommendations were only 3. The first one was that the Central Drug Authority needs to be autonomous and have independence. It gave a few details about that, but that's something that we've known for years. About 15 years ago, Deloitte and Touche wrote a report which said basically that the Central Drug Authority must be taken out of the Department of Social Development and must be independent and have its own autonomy. The second recommendation was that the National Drug Master Plan should be reviewed. Quite rightly, the law actually requires us to review that every 5 years, and that we've done, and you now have the 2019-2014 plan, which is much more implementable, has taken a completely different approach. To develop that plan, by the way, we consulted for the first time with users of drugs. We went into the streets and met users and spoke to them about what they wanted and what they needed, and they told us about their problems. Largely integrated. The last recommendation, if I may mention, was funding for the Central Drug Authority.
Members, Maleka.
Thank you, Chairperson. I want to check what is your understanding of good governance, including its main features, and how would you ensure good governance in the CDA?
Good governance starts with ethics. Everybody must have the right ethical principles, and there's no deviation from what that means in order to ensure good governance. What is then required is rules. We have some rules in the Act, that Act 70 of 2008, and we have some rules that they are governance rules that were published in the Government Gazette in 2007. Those rules need to be improved and strengthened and clarified. As I said, we have a draft document which needs to be improved, but was held up by the line function for the pending Act, which is going to be changed. And we were only told that at our meeting on the 26th of October. We need to go through those rules. They themselves need to be redrafted and re-edited, because with time, nothing is perfect. And with time, we've recognized that there are other things that need to be changed. So good rules, and then a strong team to implement those rules, apply them and abide by them. There are other things that apply, such as the King 4 report and matters that would relate to general good governance overall. But when the Central Drug Authority good governance, it requires understanding government and departmental systems, dealing with budgets, which we at the moment don't have access to, and that's why we need to be autonomous and independent from the Department of Social Development. We have the rules, we apply them, and a good team will make sure that they work.
Thanks, Chairperson. Mr. Uko. My question is, what are the key issues affecting young people, their families and communities regarding drug and substance abuse? And how would you advise the government to deal with these issues? You have 3 minutes.
I think the major issue is boredom. Family problems, unemployment, as I mentioned before. If we can get the youth involved in many other activities, they won't be tempted to use drugs. They use drugs for reasons, and they boredom. They want to escape, and unfortunately, it's a bad escape. It would be much better to escape into a productive pursuit, like sport, playing football for a team, or any other sport which they like, but that requires facilities. You need football fields and tennis courts, basketball courts, you need big halls for judo, for gymnastics, for badminton. There's a lot of things that the youth can do, and we need to make sure that that's done. We need to have better education so that the youth are encouraged and given the ability to make good choices. We must make healthy choices easier choices for the youth. That's the key issue. A separate issue is to deal with the drugs and the drug trafficking and the criminals and the drug lords. That's not in the hands of the Central Drug Authority, it's in the hands of organizations such as the Hawks and certainly the South African Police Service. They have to deal with that, but that's one of the issues. Let's deal with it at root level. The people who use drugs, encourage them to make healthy choices, make those healthy choices easy, give them diversions to do other activities, and not be tempted into getting a high, which is temporary and never works. Employment is a key issue. If parents are employed, then they can afford to buy sporting equipment, football boots and things for their children. So that's a key issue, and we need to liaise with the Department of Trade and Industry on that score and all the other departments that can contribute to improving the employment levels and certainly reducing our unacceptably high unemployment levels that we are experiencing.
Thanks, Chairperson. In your opinion, what is the state of public rehab centers in the country? Are there any challenges with regards to access to public rehab centers in South Africa? If yes, what are those challenges, and how would you advise the country to address those challenges?
The basic answer is that the treatment centers are not good. They're not operating well, they're overcrowded, and the waiting lists in the public treatment centers, the government-owned and run treatment centers, is too long. Even if a court sends someone to a treatment center, they can't get in there on the court order because there's a 6-month waiting list. And that's a tragedy. So we need to have more treatment centers. And in those treatment centers, we must have more trained, better trained, and better motivated staff. If we get back to the prevention level, if we do that right, we will need fewer treatment centers. But that's not a problem because treatment centers can always be converted into local clinics and other areas that can help people. But the state of the treatment centers is not great. In the public sector, we have many treatment centers that are functioning poorly. It's an area where the drug addicts go and target people because they know, the drug dealers, I apologize. The drug dealers go and target people because they know they're addicts, they're being treated. There are some, too many, treatment centers that are not even registered. We need to deal with that. I've got no problem with private treatment centers, but they need to be regulated, they must be registered, and they must be doing a good job. The key issue with all those centers is not the treatment and to get people off drugs. The key issue is to reintegrate them into society and keep them off drugs.
Can I just do a follow-up on that question? Mr. Uko, as a previous board member, the issue of the treatment and prevention campaigns, the CDA board, what was your recommendation to the department or to the minister on that one previously?
One of the key recommendations was to have a treatment center, at least one in every province. I don't know what the status is at the moment because the reports have not come to us. Again, it's through the administrative processes and the support staff of the Central Drug Authority that we do not get that information. There was a treatment center opened in KwaZulu-Natal very recently, but despite those treatment centers being opened, we still have a shortage. There are waiting lists and people cannot get in. They want to. Families motivate their children, for example, who are on drugs to go for treatment. You can't force anybody to go. It just won't be effective. But if they are willing to go into a treatment center today, then they must be treated whilst they are willing, not in 6 months' time when they think, oh, there's no point. And so we need to increase the number of treatment centers and the number of trained staff to do it. We need to deal with the chemical treatments such as methadone and naloxone, so that the users can easily get off the drugs on which they're addicted. The problem is that we mustn't go on and on with these programs. For example, needle exchange is, I think, a very good method of reducing harm. We address things like blood-transmitted diseases like hepatitis and HIV by giving users clean needles. But that can't happen in perpetuity. We need to get from the users a commitment to abstinence. They must make the decision that eventually they'll get off the drugs completely. And that's the way we will succeed in the long term. That requires, again, reintegration and keeping them busy, entertained, and employed and off the streets. We need to solve the family problems that give rise to drug addiction as well.
Thank you, Mr. Uka. Is it now Ms. Aris? Are you next?
Mr. Uka, one of the challenges facing the country is a lack of comprehensive national statistics on the prevalences of substance and drug abuse. How can the CDA play a role in this regard?
There are several levels that can be taken there. First of all, we have the Medical Research Council, and they run a program, SACENDU, the South African National Community Epidemiological Drug Research. And we need to expand the number of clinics and treatment centers, private and government, which provide input into the SACENDU reports. We need to do that more regularly. The second reports are great. We need to expand the base of information so that we have more accurate information. As far as the Central Drug Authority is concerned, and it's a principle in the National Drug Master Plan, that we base all things that we do on evidence and on science. Now, I'll tell you what happened at the Central Drug Authority in the past. We had a member called Dan Steyn, Professor Dan Steyn, who was the head of our research unit. He repeatedly submitted programs for research and budgets for funding that research, and repeatedly got nothing, because the budgets that we submitted, and I saw the same thing, I head up the Communications and Marketing Committee. Every year I submit a budget of what we want to do and how much money we need to do it, and that budget never gets past the administrative unit with whom we liaise into the finance and the greater budget of the Department of Social Development. So there's never been any funding for community and communications and marketing. It's the same with research. There's never been any funding despite our requests for budget. What happened to Dan Steyn? Like the member who withdrew last night. He threw his hands up after about 3 years and said, that's it, enough, I'm not taking this abuse, I'm not taking a dead end, and he resigned. We stayed on to fight that, and we can make progress, but we need independence.
Thank you.
Good morning, Mr. Ugo. Recently, there's been a much debate around the court judgment, the constitutional court judgment on the decriminalization of marijuana, cannabis, and all of that. So I would like you to share your opinion with the panel regarding that court judgment. Thanks.
Yes, thank you, MP Stock. It was a constitutional court ruling, not necessarily a judgment. It was a slightly different thing in law. And they ruled that there were certain portions of the Act which were unconstitutional and gave the government 2 years to change those. The 2 years expired in September, but it's reaching the final stages now. I think that the ruling was good. I think that the decriminalization of private use, personal use, is better than the criminalization and punitive action taken against users. And that would apply to most drugs, not only cannabis. The Central Drug has a policy statement on marijuana and cannabis. It was published recently in the South African Medical Journal. And it states simply things like the war on drugs has not been won, so the war on cannabis has not been done. We need to allow personal use, but we need to advise people that THC, which is the tetrahydrocannabinol, which is in cannabis, is a mind-altering addictive drug. So if they make a choice to use it, they must know that it is harmful in the long term. Users of cannabis have many problems. If we allow personal use, it needs to be controlled in many ways. And one of the ways is the medical use, which I think is appropriate. There are many uses of marijuana which have been scientifically proved to be good, but we need to know that it's controlled, because there are various different plants, and you don't know how much THCs are in a plant. Some can have more, some can have less. So if you control that medically, that a user of medical marijuana knows what he's taken and has a controlled dose and knows the benefits, then there is certainly good use for that. So overall, I think the ruling was good. The changes that the legislative is proposing and will come before Parliament, I'm sure, in the new year, if it hasn't been presented yet, are good. The personal use decriminalization is a good move, but itself needs to be managed in a way that doesn't affect others, because if an adult decides to use marijuana, the children in the household and other family members need to be protected, because any smoke, it doesn't matter if it's smoke from a braai or a cigarette or cannabis, any smoke in your lungs is harmful. The smoke from cannabis contains TCH, which is addictive and harmful, a mind-altering drug. So that's the problem. We need to know, again, that people who make choices, the right choices for the right reasons.
Thank you. During the COVID-19 pandemic, government introduced a number of lockdown regulations to contain the spread of the virus. And then one of the regulations which I want you to focus on is the regulation on the ban of alcohol. It was also on the ban on tobacco, but our focus should be, I mean, your response should be more on the focus on the ban of alcohol. So I would like you, if you had to advise government, what was going to be your advice regarding the sale and ban during lockdown and any pandemic which might persist in the future? Thanks.
First of all, we should recognize that prohibition doesn't work. A ban on any product, and we see from America in the 1920s that prohibition doesn't work. It gave rise to the mafia and crime syndicates. So recognizing that it doesn't work overall. However, when we have a crisis like the COVID-19 pandemic, we need to deal with the realities of that crisis. And the banning of alcohol, I think, in the short term was a good thing, because people get careless when they drink too much and they want to have parties and they get drunk and they lose control of themselves, and then you create an environment in which the virus could spread more easily. People will tend, when they drink, not to wear their masks or to get all excited and sing and shout. Now, as I'm talking to you, little droplets are coming out of my mouth. There's no question about that. But if I were singing or shouting like at a party, those droplets would carry further. So there is an increased risk. And I think that the ban on alcohol was a good thing in the short term. It also led immediately to a reduction in admissions to hospitals for violent crimes and injuries, certainly a reduction in rape and in women abuse and child abuse. There's no question about that. What I would advise the government to do, if it were ever to happen again, is to communicate more with the public, because what happened is we banned alcohol. We didn't tell the public clearly why and give the public a motivation to stop drinking, or at least when they start again and alcohol is available, to drink less. South Africa has a bad reputation for binge drinking. A lot of people drink, but they drink less during the week, and on the weekend they binge, and that's where the bad things happen. That's when the violence happens. That's when car accidents happen. You know that we have 15,000 to 20,000 road deaths a year in South Africa. About 60% are alcohol related. We've got to reduce that. So the short-term ban was good and effective. It needed to come with information to get the public on our side or on government side to see and understand why the ban was required. And it's very similar with tobacco. The ban went on a little bit long. Thank you, Madam Chair.
Thank you, Mr. Uku. Thank you to the panel for that questions, Mr. Uku. Is there any question that you want to ask the panel?
I don't have a question, Madam Chair, per se. I'd like to give some input to the panel for consideration. The way I understand it at the moment is that I am the only sitting board member who is on the shortlist and having interviews. If I am not appointed, there will be no memory, no knowledge of what is wrong with the Central Drug Authority and how to fix it. We cannot lose that. And so my plea is to you to appoint me, not for my own benefit, because there's no real... Well, I think, yeah. I think that every interviewee would have made the same statement. They all are here because they want to be appointed. But there are very strong reasons for me to be appointed, because I know how it works, I know what the shortcomings are, and I know how we can overcome them. What it needs is a team. We need, what I'd like to see from this panel appointing, is people with the right qualifications, people who have the right background and the right desire to want to work. What I'd like to see is fiercely independent thinkers who can contribute enormously to the Central Drug Authority and its growth, but independent thinkers who have the willingness and the capacity to work as a team. So if I were appointed, the first thing I would recommend is that we have a 3-day indaba very soon after the appointment of the board, hopefully within 3 months. We have a 3-day indaba, and I will bring to that indaba a few things for the new members. One is an expert who will talk about the National Drug Master Plan, and I have an idea of who I would use there, so that the members can understand the National Drug Master Plan as it is now and start planning immediately for the next review. We need to know that the 2014-2029 Drug Master Plan starts now. We can't wake up in 2029 or 2024 and decide to make that plan. I would have a list of the current act that we want to change and what those changes are and why. There's a proposal that we change the name, which I think is ludicrous. The Central Drug Authority is a great name and says it all. I would have some required reading, for example, the World Drug Report. I would like to see every member get familiar with all the reports and the information that's available. Not learn over the next 5 years. We must learn quickly and then work and be successful over the next 5 years. I would like to see members introduce themselves. And this will be my last point, Madam Chair, if I may. We don't want to allocate people to committees. And we have 4 committees. We don't want to allocate someone to research who's not interested in research. So we should learn from the members who they are. We'll do that at the indaba, and where their interests lie. Who wants to be on the research committee? Who wants to be on the governance committee? And allocate people to where they want to be. And that's where they'll make the best contribution. And I will add to that success. There's no question, Madam Chair, and I really am the only one with that memory of how to overcome the shortcomings. If I'm not there, the new members will be misled by the administration and they will make all the same mistakes over again. Please let that not happen.
Thank you, Mr. Ugo. Let me just appreciate your honesty, and let me just also appreciate that luckily we're in a democracy in this country, and I allow you because of fairness, and I also allow you because I believe in freedom of speech. And I need to thank you for coming to this interview open-minded and with honesty. And from our side, we wish you luck and have a safe journey back home. Thank you. Members, before we go for lunch, is there any news for us? Marcel, if you can come back. Member Stock. Member Stock has asked a question before we go for lunch. What if Free State members won't arrive? And what if they arrive later? Thank you, Member Stock.
Thank you, Madam Chair. I raised this question of what if they don't come because they're in Joburg. So we don't have a guarantee that they will come, but we're expecting them anyway. So in any eventuality, if they don't come, what is it that we're going to do? So I wanted to propose that if they don't come, if it happens they don't come, it's only 2 candidates. Let's do it on virtual. If maybe they come after 5 or later than that, or so, or for whatever reason they don't come, let's be allowed to do those candidates on virtual.
Can I be guided by the staff? Can we do an arrangement like that? Because we must also still do the scoring and all that administrative stuff that needs to happen after we finish with the two candidates. Yoli, Tabi.
Want to speak? Thank you very much, Chairperson. Members, it will be a decision of the committee that if they want to conduct virtual meetings, so we can make arrangements for such decision. We can implement such decision, but the process will affect the program of the subcommittee. But we can arrange that for a virtual.
Let me just come in. Already our program, ne Audrey, is very full. What do we have tomorrow? Two committee meetings. From the select committee, there's committee meetings and education tomorrow.
No, Chairperson, I just wanted to make a proposal, but it's not for now, it's for the future, Honorable Masango. You know, if it happens that again we have interviews in the future, our candidates must be allowed to sleep over in Cape Town to be ready for the morning. I mean, if for an example you check now, we had another candidate here yesterday, the one who was panicking, she did not perform good, anyway we accept, but the way she was panicking, she indicated in the interview, the flight arrived and I was told Cape Town, you must be in Parliament, and then everybody's panicking. So I don't think it's fair also on the part of the candidates. So what we need to do for the future, if there's interviews, let them sleep, let them come, travel, sleep over in Cape Town a day before, and then they're allowed to book in a hotel so that they prepare and be ready for the morning. Yeah, I just wanted to make that proposal, ma'am. Thank you.
Chair, I believe that we will be getting progress reports from the support officials as we go along, because obviously they should be on their way somewhere at the moment. So we just need to give ourselves, as the chair is saying, a deadline or timeline of sorts, that if nothing happens after such and such a time, then we need to regroup and see what we can do. But having heard the colleagues from the NCOP saying that the program is full, we need to make sure that we get these interviews done today somehow. Yeah. Thank you, Chair.
Chairperson, maybe I can just give an update. The lady is saying now that the rescue flight has just landed. The rescue flight from Joburg to Bloem. Remember, they were waiting for a plane from Joburg. They are still in Bloem. The flight that was supposed to come and help them has just landed. They should be here by the afternoon. As long as we know that they've boarded, then maybe we can proceed or even do a virtual from here. I'm not sure. But for me, I was saying to her, we need to know as soon as you leave Bloemfontein. But like she's saying now, the flight, the rescue plane has just landed in Bloemfontein. Of course we can, Chair, but my worry is now these people have now checked in at the airport, ready to board that flight, and then I should tell them now to get off that flight and go back home to connect virtually.
Marcel, I don't think that's what the chairperson is suggesting. The chairperson is saying, let's allow them to still come to Cape Town, depending on what time they are going to arrive. And then if they arrive after 4, then we do a virtual meeting. Because I'm sure they will also understand because of the technical glitches that they experienced. You know? So they will still have to come here to Cape Town. We're not saying they must go back and then we do virtual from their homes. I don't know if that's what you are saying, Chairperson.
Thank you, Chairperson. May I perhaps suggest that we assess the situation after lunch and then we take a decision after lunch. But in the meantime, Marcel and Sis Lindiwe will check about the possibility of setting up the virtual platform.
Dad, was so to kapa seZulu, kapa seVenda, kapa seXhosa? O semolla ka Sesotho. Re. Ke utlwile ntate. Re thabela ho bona. Ha re o dumedise morena le ba mohela. Ebile ra tseba mathata a le kopane le ona. Re leboha fela hore Modimo o ile a le thusa. Hore le fihle mo le santsana le phela. We must thank God for that you're still alive. We understand you are not responsible for this. So we are happy that you are alive. Thank you very much. Ntate Mlahlegi, we are going to do a quick introduction, who we are, and then we start work. The time is no longer on our side, but we will do the normal time. We don't even be worried about that. Libito la ka ke Mondli Gungubele, chair of the panel interview. Ma'am.
Good afternoon, Reverend. My name is Marinsha Gillian. I'm the co-chairperson of the panel.
Good afternoon, Reverend. My name is Dikhang Stock. I'm a member of the Portfolio Committee on Social Development, also a subcommittee responsible for interviews. Thank you.
Good afternoon, sir. My name is Bridget Masango, the member of the Portfolio Committee on Social Development and member of the subcommittee. You are welcome.
Good afternoon, sir. I'm Letitia Aris, member of the Portfolio Social Development. Welcome.
Good afternoon, Mr. Sokana. Welcome. I'm Delmaine Christians. I'm a member of the Select Committee, the Social Cluster, and also of this committee.
Afternoon, Rev. My name is Audrey Malika. I'm a member of the Select Committee and member of a panel.
Now let the game begin. Ntate putso ya pele e tlanka metsotso e meraro ka puisano ka hara nna le wena. A conversation between us will take 3 minutes. I'll take 5 seconds of that. Simply asking you about yourself, who you are, and what made you to be interested in this job, and what do you bring. You've got 2 minutes, 55 seconds to do that.
Thank you so much. And then, good everybody here. Thank you so much for being with me this afternoon. And then my name is Ruben Sokana, and then I am in the first place, I just want to say to you, I'm Reverend Sokana. I'm from Free State, and I'm born in the Free State. And then once again, I'm being influenced by some of the leaders who worked in the substance abuse many years ago, as I'm also the expert in prevention program, in prevention services, and also aftercare. And then since 1996, I am the hard worker. I'm also passionate to work with the people. I've been influenced by the many leaders who inspire me to make sure that now I grow and assist our communities to change the perceptions and behavior, the lifestyles of the community members, especially those who are using and abusing the substance in our community. So since 1996 up until here, and then I have made sure that now I change so many people in our community, also my villages. And then I've been the chairperson of the local drug action committee for many years, the deputy chairperson of the provincial forum in the Free State, and then I've been there for more than 11 years. And then I've been attending a lot of the international event that was organized by the CDA and also the National Department of Social Development. And then that was also inspired me that I need to improve my services where I'm serving. And then and it has also engaged me that now to my area, I should also interact with the other stakeholders that are also continuing in a way that now they've been produced a lot of fruitful in our communities. Thank you, Ndatu.
Sir, the Central Drug Authority was established by an Act of Parliament. Which act is that? And what does the act seeks to achieve? You have 5 minutes to answer this.
Thank you so much. The Central Drug Authority was established under the Act of 70 of 2008. And that act have developed what we called the CDA, and also the roles and the responsibilities, and also this the strategical plan that has to respond on in the interventions. We remember we do have supply reductions and the harm reductions and so on and so forth. And then that is responding, the research, a guiding tool of the National Drug Master Plan that is also guiding us to make sure that now we do implement what the Act says. Because now, if you read correctly, the Act 70 of 2008, it will tells you that now no one of the community-based services should be rendered in the community if they are not even registered. So it drives us that now any program of the substances, all the community-based services need to be registered and ensure that now are complying and reporting to the CDAs. And then it also tells us with some of the roles and responsibilities of the LDAC, which is a local drug action committee. So that act, it's also help us to make sure that now we do implement the CDA implement and guides the minister and make sure that now the provinces are reporting to them, or are reporting to them, especially these 3 spheres, the provincial forums and also the local drug action committee has to be work together with the CDA.
Thank you. In your own assessment, do you think that the CDA performs its mandate efficiently? If yes, how so? And if not, what are the shortcomings? You can highlight both with regards to its mandate as well as ensuring compliance, accountability, and monitoring, development, and implementation of the departmental drug master plan by national and provincial drug master plans by provincial forums. And then there's another question, and how are you proposing to address these shortcomings? You got 8 minutes. If you want to write the question down, you can write it down. If you don't get it, then.
Maybe, if maybe. Okay, if maybe okay, can you also repeat the first question?
In your own assessment, do you think that the CDA performs its mandate efficiently? If yes, then you tell us how. And if not, what are the shortcomings?
Thank you so much. Ma'am, really to me, since we have gone through with the, together since the past 5 years with the CDA activities, for sure, the CDA, they've done something in our country. And then let me tell you something. When they've been organized, the international event conference there in Boksburg in Gauteng, really through the report that we have been received there today in Gauteng in 2019, in 2019 November, the 1st of November, through the report that we have received, it has been indicated to us that now members who served it to the CDA, really they've been worked so hard to interact with so many stakeholders and work together with the international. There was a chain between when you listen in their report on that. And then what I've been also in learn with the achievement of the CDA is that now, all these 3 to 5 years, I've learned that now there is a conversations in our provinces with regard to the reports. And then sometimes if now the reports are not there, remember I'm also the deputy chairperson of the provincial forum in the Free State. And then my secretarians were used to even to update me that now there is a need to now to report on the 1, 2, 3. And so that it has been indicated to me that now the CDA has played their role indeed these 5 years. And the other thing, what I couldn't see clear is that with the CDA is the manner in which the treatment services are so expensive that are not accessible to the people, especially the private. That the CDA it seems as if they are not making a noise on that, because these private treatment centers, people are just looking the money, and only to find that now the most people who need the service are people who don't have nothing. And therefore people fails now. We fail them because we got limited resources in our country, such as the treatment centers. So I haven't heard the noise of the CDA to say now this one really, although the government is doing something on the other hand, but the private sector really, when they saw the client, our people who are addicted, they saw the money. They saw money. They don't care that now somebody had to go back or reintegrate to their community. So it was just that now I was just maybe asking myself why the CDAs can't, because they have authority to advise the minister with this. It's not only to give people the licensing, that now such a treatment center is fine, such a treatment is fine and is complying with the norms and standards. But really the price that we have currently in the South Africa for only one client at the private sector is too much. And on the other hand, the government, they do have the limited resources. We only to fund in the Free State, even we don't have even the single one of the Free State centers in the Free State, State Rehabilitation Center. We do only have the halfway center, which is Dr. Bears Nodia in the Clarence. But we don't have the rehabilitation center. It's only the private sector that we have in the private treatment center in the Free State. You can imagine now, if a lot of the teenagers that are engaged, that are involved in the substances, where now we are growing the community where now people doesn't have money, it is difficult to them. But that was only my question, that now I'm wondering where is the CDA don't want to play a role on that. Or maybe I was thought that now the minister will come up with something on that just to advise that now, or maybe to interact with this private sectors, because it's so difficult now sometimes to our African people to be access such a services. Thank you, ma'am.
Thank you, Chair. Mr. Sogana, the National Drug Master Plan 2019-2024 represents a multi-sectoral approach to create a South Africa free from the harms associated with drug use, misuse, and abuse. The plan observes national and international policies, plans and conventions to ensure respect and dignity for all people of South Africa. So if you are appointed as a member of the board of the CDA, you will be expected to implement the mandate of the authority. So I would like you to please share with the panel your understanding of the objectives of the National Drug Master Plan 2019-2024 and how you think that the CDA should achieve those objectives. Thanks.
Thank you very much. I think the National Drug Master Plan, it's a vehicle, or it's a guiding tools of the CDA with all the interventions, the community-based services. And it also guides us. So we can't run away with the National Drug Master Plan because now it's approved by the Parliament, and it also engages us that now, like it or not, we should follow some of the other amendment or the rules that are there, because it also guides us to some of the other services that are not meeting the norms and standard, and then how do we engage those three strategies. Remember that we do have in national strategies the supplier reduction, and then demand reduction and the harm reductions. With those three interventions, the National Drug Master Plan, if you get them correctly, it's helped us to respond to the community and the entire community, that through that guidance, how we can intervene and work together with the national, the provincial, and the local level. Remember, we do have the 3 years that in our document that guides us that we should work together, and there's local drug action committee, provincial forum of substance abuse, and also the CDA, meaning that we are working together. The same applies like the AIDS councils. They do have that the 3 years that are working, local, provincial, and national. But what is important here, the National Drug Master Plan, it also responds us to all the challenges that we have in the community, and also the service user, the community-based services, especially to the services that they are rendering. And then once again, the National Drug Master Plan, it is a very important document because it has been involved so many stakeholders before we can talk about the final. Remember that now, after 5 years, it has to be reviewed. And then it is a journey to involve each and every people, and then everybody inputs on that. I think in that way, on my side, for the sake of of what the CDA is doing, that's a right procedure to involve a lot of stakeholders to come and put their views on that before it can be even approved by the Parliament. I think it's to me, the National Drug Master Plan play a very important role. It's a tool. As a reverend, as I'm standing here, I will say to you, it's a Bible to me, especially to the people who are working with the community-based services. Yes.
Mr. Sogana, earlier on you mentioned how you have been helped by the international conferences that you've attended. And the plan also observes the international conventions and policies and all those instruments. I just would like you to share with us what you think the value is that is being added by the international side of the international aspect of what the plan speaks to the work of the CDA.
What I've been heard, and then with the United Nations or the other delegations there, we have learned that there is a need when we do respond, especially to the issue of the availability of the drugs in South Africa, that how we can come in and respond through this strategical plan that we have. And then the other thing that I've been learned, they've been inspire us. You remember that now they've been talk about the legalization of cannabis and so on. And then there was some other delegation who spoke about that. And then although the House and some of the other delegations, including myself, we will feel that now South Africa, it is early to legalize this cannabis. But now we do accept it, and we have been shared some of the experience on what the other area. Remember that country is Canada, when it was presenting their own experience on that how did they experience and then how did they overcome on that. Really to us, because it's something new in South Africa here. You remember all these years since we fight any presentations or any motivation that we were come across, cannabis was part of the substances that we need to advise people that how danger is and how we did, and then so now it brings us sometimes a confusion to the community that especially the Rastafarians. The Rastafarians now say, Reverend, now this thing is legalized. So what are you saying to me? So it gives us another energy to say, no, although it's legalized, but it's still dangerous in our body. And we should also add, it's just that the limited resources that we have, that we are not reaching them accordingly. So such a confusion, it will continue, but finally we need to accept today because their inputs is coming from their experience. Yes.
Mr. Sogana, prior to the review of the National Drug Master Plan 2013-2017, a need to conduct an evaluation was prioritized.
Okay.
To assess how it was implemented. And subsequent to that, the Department of Planning, Monitoring and Evaluation in partnership with the Department of Social Development commissioned an evaluation of the National Drug Master Plan 2013-2017. So the evaluation started in August 2015 and ended in January 2016. The evaluation of the older plan. So the question would be, what were the key findings and recommendations of the National Drug Master Plan 2013-2017?
What I've been grasped there with that document is that we needed to change the way that we are doing things in South Africa. But through that evaluations, it was also inspired that now we needed to make sure that now we monitor our programs in the monthly basis, quarterly basis, and making sure that now whether are we really going through with the strategical plan that it has been recommended. To me, it was just the commitment that we needed to follow. The commitment of making sure that now quarterly, how do we assess ourselves? How do we see that the manner in which that we are doing? Those reporting must engage, must show that now there is a really the impact or not the impact. I think it's just the commitment that we have to put in that. Yeah, yes.
Reverend, what is your understanding of good governance, including the main features, and how would you ensure good governance in the CDA?
Okay, thank you so much. I think when we talk about the good governance, things has to go procedurally. Actually, things has to go according with the mandate of the collective people. In other words, there should be the meetings that has to be taken. There should be also the commitment to say we do have a certain plan of action that we have, and it has to be something like 1, 2, 3. If we have been discussed earlier on, we should implement it. And then when you talk about the governance, it gives you also the oversight. And then it also tells you with how we should manage the structures, how we can also make sure that now our objectives are met. And then also to make sure that now we do our own, we make sure that now our responsibility down there with the people that are affiliated or with the people that are affiliating to us as a CCDA, we do give them the support. And number two, the other thing of the governance is that the governance, you are giving the mandate to do 1, 2, 3, that we need to be reported to somebody as like a minister. And then if you couldn't done that, in other words, you'll be having a problem because now somebody who have to guide and then advise you and report to him or her, and then you got that mandate to do that. So the governance, it's a commitment to say we need to meet in the certain time, make a plan together, decide together, do things together, and make sure that now all the responsibility spheres that are affiliating to you, you make sure that you meet their objectives.
Thank you, Chairperson. Rev Sokana, what are the key issues affecting young people, communities, and families regarding drugs and substance abuse? How would you advise the government to deal with these issues?
Thank you so much. I think there are a lot of things that are also affecting the young people. Some of the challenges is a peer pressure. That's one of the most important things because some people that are not dependent, and then they depend to other people, to the other gangs, young people. Peer pressure play a very important role to them. And the other thing is a poverty. And then because of the poverty, it's also contribute to the young people. Remember that now, our country, we do have the inequality communities. So some people, because of not deciding on their, or helping with the other people, they thought that now they will rely to the other people. So the poverty is also contribute on that to them. And then some families are growing up without their parents, and then as a very early stages. So now that lead these young people to be involved, and with no support. And then the other thing that I've been realized to the young people is that the young people, they used to have these gangsterisms, and they persuade very easily on that gangsterism. you will saw some young people who are having tattoos, and at the same time, those who are having the tattoos are smoking the dacha or other substances, are abusing other substances. So our children love that, love the tattoos. If now somebody doesn't have any tattoo, they say, no, they feel as if it's bad to them. So our children persuade very easily to this thing. And then that's why we do have some gangsterism. That's why we do have some, our young people who are affected by HIV/AIDS, because they do love money and they do love a blessing and so on.
Thank you, Chairperson. Reverend, in your opinion, what is the state of public rehabilitation centers in the country? Are there any challenges with regard to access to these public rehab centers in South Africa? And if yes, what are those challenges and how would you advise the country to address those challenges?
Right. The State Rehabilitation Center, we know that now the government, they do have their own resources that is being subsidized, that is subsidizing people who are unable to maybe to have money to pay the entry, and the government, they do subsidize them. But in some of the other things, the State Rehabilitation Center, it helps our community that doesn't have nothing in the first place. Because now a lot of young people, a lot of people in our country, they do not have money. So now the State Rehabilitation Centers assist us to make sure that now those who don't have money, they also have easily accessible to the facilities. Now, what I've been realized with the State Rehabilitation Center is that the subsidies that, the resources that we have in our country based on the rehabilitation treatment centers are very few. And then in 9 provinces that we have, people are also struggling. People are also struggling. So now it's going to also delay us to respond quicker to those who need our services, because the government, they do have their plan on their way to establish those treatment centers, but unfortunately, it's a journey. It's a journey to make sure that now are also sustainable on our provinces. And then what I would advise to the government is to make sure that now all the 9 provinces, they do have the treatment center, so that people can be easily accessible, unlike people, they can go to private treatment centers. As I said to you, that now the private treatment centers, they do look for money, not only to change the perceptions and the lifestyle of our children. So it's really a problem in our country. I don't know how we can just do that, but now what is important, my advice to the CDA is to continue to advise the minister to establish so many treatment centers, state rehabilitation centers in our country, so that our inequalities communities, they can have an access to the facilities.
Thanks. One of the challenges facing the country is the lack of comprehensive national statistics on the prevalence of substance and drugs abuse. How can the Central Drug Authority play a role in this regard?
Can you repeat again that question?
One of the challenges facing the country is the lack of comprehensive national statistics on the prevalence of substance and drug abuse. how can the Central Drug Authority play a role in this regard?
Thank you so much. I think what is important, the challenge is down there at the in municipalities. We remember that now the Act of 70 of 2008 also engaged that the municipality has to take a lead in terms of the initiative of this. But what is important is that we'll find ourselves that there are very few municipalities, mayors, the premiers, that are also take the responsibility on this. So this demolize our dignity or our instrument that we have. We are doing something down there, the local drug action committee, but the mayors fails to give us a support. I don't know what mechanism that we can use on that, but what is important, I think the challenges here that I've been experiencing is that in the local level is there we need a very effectively programs that is going to inspire the local drug action committee to make sure that now they do report on the new drugs availability, and they do report on the challenges that on what they have been experiencing. If we can maybe make an effectively of this local drug action committee, I'm telling you, we can run this program of the CDAs, and then but the things that we are supposed to be implemented, if are not implemented accordingly down there at the local, is there we will fail our people on the other hand. But to me, I will say that now if we can make the local drug action committees be effectively, the same applies like the AIDS council, local AIDS councils. So to me, to us here, if we can make sure that now maybe the mayors are engaged, sign the commitment with the premiers, also I think we can play a very important in this structure, because now this is a higher political agenda. This issue that we are talking, we must put it into a higher political agenda. But unfortunately, we find ourselves that now there are some stakeholders that are working there, and other political leaders are there. So it makes us not to be very strong, so that to be effectively locally.
I did hear that you were saying that the local sphere of government need to play a key role, specifically the municipality. Do you think that the local government is the only role player in this?
Not alone, together with the social development and the other stakeholders. Yes. We say 1 minute. The other thing that I want to address here is not only the municipality, together with the social development. And the social development is playing a very key role in it. And then, but we need to ensure that now locally the different department, stakeholders, private sectors, businessmen are also part of the initiatives. And then that's the way that I believe that. It's not only the municipality. Yes.
Thank you very much, Reverend. I think the question that I'm going to ask you, you have partly covered it earlier on in your response. So I just want to pose it to you, but we allocate like 3 minutes to you, and then you will be able to deal with the question. Recently, there's been much debate about the court judgment on the marijuana, the cannabis, around the private use of, or decriminalization of the private use and all of that. So I want you to share with us your opinion regarding that co-judgment. Thanks.
Thank you so much. Then, with regard to marijuana, that as one of the aspects of the prevention service in the community, really I've been experiencing a difficulty on our presentations, especially on our dialogues and so on. And as, with regard to this cannabis legalizations and so on. And then, but what is important here, we understand that now there are some other religions that is behind that. And then some people, they feel that now their feeling has now been adopted, at least they will be free. But unfortunately, things are still going to be worse, especially to us as the community-based services. The challenge is to us now, with the resources that we have, to give an understanding to the people, and especially through the booklet, the resources, convincing them to make sure that now they do understand better. Remember earlier on, we were also saying that the cannabis is illegal. So now we have changed that speech now. We have said now, okay, after all this, we have said, okay, now, although it's no more illegal, it's legal, but people has to follow 1, 2, 3, because there are still danger effects of it. And then we need to make sure that we address it. It is unfortunate that now we are in need of the resources in our country. And it is only the Department of Social Development who will say 1, 2, 3, 4, 5, and then only to find that now other people are quiet because they don't have any resources on that. So this is our chance, even to our congregations, that it has been affect our congregation. Because some people who are smoking daga, they will tell you, no, I'm not going to attend such a churches because the such a church, a pastor will always say, punish you on 1, 2, 3. They divide themselves according with their beliefs. But it is not that. It's just that we need to make sure that we give our people a guidance through to this amendment. We see what is important. When the parliament approves some other laws, this thing of circulating the inputs to the people, it goes to the other people who have never even having a say with the input of the draft. You only to find that now, you'll hear that now the draft has been taken, have been circulated among the 9 provinces. If you can ask that, who are those people who were there? You'll be surprised and say even the single local drug action committee was not part of the meeting and so on. That's another thing. It gives us a really problem. It's not inspiring us in that way, but now, to me, the South Africa to legalize the cannabis, truly speaking, it was early to us. It was early to us because of the resources that we have. And 2, they've been looking only the marketing structure and the productivity and so, but without checking whether how people are going to be danger.
During the COVID-19 pandemic, Reverend Sokana, government introduced a number of lockdown regulations to deal with the spread of the virus. And then one of those regulations that were introduced by government dealt with the ban of alcohol and then the sale of tobacco as well. So I would like you in your response to focus more on the sale of alcohol, the ban on the sale of alcohol. So if you were to advise government, what would be your opinion or your advice to government how to deal with such issues in the future if such pandemic persists? Thanks.
Thank you so much. I think this issue of the COVID-19 really, to us in South Africa, it was a bomb to us because it came at the time that really we still need a lot of support to our government. And then you can also see with the statistics how people are dying. it's also clear that now people, we do have a portion who's got a misunderstanding. But we have spread the message of prevention service with regard to COVID and people how can responsible or drink and so on. But what is important in that is that now, in most cases, when the liquor outlet or the tavern and the bottle store are closing, the time that are opening, you'll see a queue line, people looking for the alcohol, and so and so. That is also indicate that now, our country, we still really, we are still really need a lot of job that we need to do to help our people, because some people drink alcohol, abuse alcohol, use alcohol as a culture now. And that's why we have the problem of these people who are not understanding the danger effect of this. And also to take care for themselves. There are also taverns that are not that are not even making sure that are complying, even bottle store. But there are policemen, there are stakeholders that are responsible for them to do that. But it's not an issue. People has to be disciplined before they can do something. But it is their responsibility. So it is a little bit a journey to us. But in the near future, in our government, with regard to this epidemic, I will advise that it is very important to make sure that information transmission play a very important role. Because really, the information transmission, if people don't have enough a booklet or the information, the radios that are also take care for this important information to make them aware, really we are going nowhere. Yes. And then I will advise the government if they can just do that, and the next time, and I will advise if there will be any one of the other diseases or epidemic that will come to our country, really, I will advise next time that now the government should focus, especially to the key role stakeholders that are in the communities, so that people can influence the other people easily, that how the danger and then how people they can take care for themselves.
What's Chairman? Anyanifer. We thank you very much for the opportunity to share with us on various questions dealing with certain topics under one topic. Do you have any question or comment before we part ways?
Thank you so much, Shepherd. And then to me, I want to thank my presence to you, representing my Free State, my province in the Free State. I want to thank for selecting me among the other members to be part and parcel of your shortlisted. I want to also to thank the questions that I heard in this house. It has been inspiring me that there are a lot of things that I need to do it if I will find myself being a member of the CDA. And number two, I'll make sure that the issue of the governance is approved to our structures. Thank you so much. I had ke modula stulo ke tlameha ho robala because with a flight e nngwe fela e ne le yona eo e la tloga Gauteng.
Engwe Free State le flight engwe fela. Mosepe o tsamaya hantle ntate. Please be safe. Thank you very much.
Thank you so much. Thank you so much, ladies and gentlemen. Thank you, my panel. Thank you so much. God bless.
Age Honorable. Yes, Honorable Member. May I take off the mask? Okay, thank you. Mahlohonolo Sobeng Sophia Maboe. Sobeng Sophia Maboe. Maboe. Yes. Thank you, Honorable Member.
In spite of the incident which delayed you, God saw it fit to put you where you are going, to reach your destination, which is this meeting. Our Lebo Mudi.
Definitely saying amen to that, Honorable Member.
Thank you very much. Thank you, me Sophia. Re tla itsebisa mo wena pele re qale mosebetsi. We will introduce ourselves before we start. My name is Mondli Gungubele, the chair of the panel interview, or the interview panel. Hey? Yeah, studies Lula comes in.
Good afternoon, Member Boy. My name is Dikhang Stock, member of the Portfolio Committee on Social Development, also part of the interview panel. Thanks.
Good afternoon, Ms. Maboe. My name is Bridget Masango. I am the member of the Portfolio Committee on Social Development and the member of this subcommittee that's doing interviews. You are welcome.
Good afternoon, ma'am. I'm Letitia Aris, member of the Portfolio Social Development. Welcome here.
Good afternoon. I'm Dalmain Christians. I'm a member of the Select Committee on the Social Cluster as well as the subcommittee.
Good afternoon. My name is Audrey Malika. I'm a member of the Select Committee and a member of the subcommittee.
Mama, we are going to start the exercise, which is the primary object of our session with you. Putsoyaka Pili will take a 3 minutes conversation between me and you. I'll take less than 5 seconds of that. 2 minutes, 55 seconds will be yours. First, if you can tell us a bit about yourself and why are you interested in this job and what are you bringing?
Thank you very much, Honorable Chair. Firstly, let me appreciate the patience of the committee to have given us the privilege to come through and be interviewed today. Answering the question now, let me begin where it relates to social development and the related fields. Who I am, I've been a servant of the community and the people in many roles and positions that I have held. However, more specifically in social development, I have had the opportunity of sitting in the government space of social development and community service in this manner that I also served as the HOD of social development in the Free State province, but it's over 6 years ago. Though now coming on this end of community, I've been doing also community interventions when I got out of government. Then I went into civil society in community service. And in that angle also, I have had the opportunity to serve even in the area of alcohol and substance abuse. I have served in numerous positions in and out of government, in the academic sphere, in a number of tertiary institutions. I could just mention, for example, UWC, then it was still Peninsula Technikon, even though it has changed the name now. I have also served at what was University of the North then, but now the name is also, it was called UNIBO, University of the North, then it became University of the Free State. So I'm just talking in terms of the social interaction and fabric of service. And now coming home to what would I be bringing into this space of intervention is that even currently I still do grassroots work in terms of community interventions and individual interventions, because I'm also a registered psychologist, so I also see clients who have challenges with alcohol and substance abuse. At the community level, I serve in a foundation called Dream Team Foundation, and we're even partnering with the University of Pretoria on the COSAP program. Which is, of course, the brainchild of the university together with City of Tshwane, and of course the Gauteng Department of Health and Social Development. I'm trying to keep to my limited time, so I will request that if at all I'm going beyond that, it should be indicated. Maybe the two last things. Yes. Okay, Bob. Yes.
Thank you, ma'am. My question to you is, the Central Drug Authority was established by an Act of Parliament. Which act is that, and what does the act seek to achieve?
Thank you, Honourable Member. The act is Act 56.3. And it is actually Act number 70 of 2008. And what it actually seeks to achieve is to make sure that the intervention in the area of alcohol and substance abuse is in a coordinated and a coherent manner, but where policies are developed, procedures and strategies of intervention, but also at the same time making sure that the different spheres are interacting, be it at a governmental level and also interfacing with community. But in essence, also responding to, I would call it the 3 pillars, which is harm reduction and the demand and the supply, to intervene in those spaces so that those who are giving intervention will also be more evidence-based, because when there was progression, the Act now commanded that those who are serving in that space should also have programs that are evidence-based and also structured in such a way that the interventions are national, provincial, local, so it is in that broader sphere of intervention. Yes, ma'am.
In your own assessment, do you think the Central Drug Authority performed its mandate efficiently? If yes, how? So, and if not, what are the shortcomings? You can highlight both with regards to its mandate as well as ensuring compliance, accountability, monitoring, development and implementation of the departmental drug master plan by national department and provincial drug master plans by provincial forums. And then I would also like to know from you, how are you proposing to address these shortcomings? You got 8 minutes to answer me on that.
Thank you, Honorable Member. Let me begin at the point where I believe that when Parliament had to resolve that, there had to be an introduction of additional or new members in the committee. It's because some of the challenges that were there for the committee to handle were not necessarily handled that effectively and efficiently. And let me now be specific to it. In the interfacing of the interactions in that space, I realized that whilst one was interfacing at the especially provincial and local level, that even when you ask many people what does, CDA stand for example, they don't know. They don't even know that structure. So there was a disjuncture in interaction from the national, provincial, and local in many ways, which also brought about the sometimes silo-ish operations, even though the intention is to be coordinated, integrated in approach, but that gap continued. So there wasn't much impact, even in the interventions that we have had at a local level, trying to build them to provincial level, that gap was there. So whilst there is a brilliant National Drug Master Plan, even revised, with a plan to make it evidence-based, to have impact in the communities, the implementation thereof is one other challenge. It's not that effective because also the focus, for me, I believe that what the central the Central Drug Authority should really be reinforcing is taking this process back to Batupili, having meaningful consultations that are speaking to what is real on the ground. Because it's one thing to have a policy at a higher level, which at the baseline level, it's not really talking to the reality that is on the ground for communities. The monitoring and evaluation, I have not really seen it meaningfully at a national level, but where I also have interfaced at the provincial and local level, there have been attempts not necessarily on monitoring and evaluation, but more on meeting programs, but not also meeting programs in a coherent manner. It would be there is so much money that is available either to a city, because one also interfaces quite a bit with the city of Tshwane, as an example, or there would be a provincial budget, and then you'd find that at a provincial level, it will be locals. We have some resources, submit, bring programs that you are having alignment with the plan, and then that way it's not really a well thought through and the plan that will really bring results. It is more activity oriented than actually evidence-based. And then just last one quick thing on the actioning of the plan itself. Because for me, the focus has been, even with us at social, be it social development, or when I was at social development, or even at a civic society community structure level, it has been more of being reactive than proactive. We have not been focused more at the preventative. We would be more on the tertiary level, not the primary level where we have to intercept even before some of these young people get into drugs and all of that. And where you'd find that at the tertiary level, there's not much of identifying those who are at risk. It is more of, now that they're in drugs, let's see what we can do quickly. So that disjuncture still poses a challenge, and I believe that's where we need to really be focusing, deal with the preventative level, so that our actions, our programs will be responsive, but also bringing other government departments on board. Because when education is not significantly working with social development, for example, to make sure that those children, even at ECD, don't even start, we would not have a beneficial process that will change the equation. Because some of them start there with some of them coming from mothers who were already abusers. And therefore, nobody pays attention of the risk there. And then when they go to the next level, they're already users. These days at primary school level, we are dealing with such crises because no one is actually thinking that they are users. And then the tertiary then becomes a very late stage of intervention. So the monitoring evaluation does not become effective when we don't start it at the prevention level. Yes. You're welcome.
Ms. Maboe, the National Drug Master Plan 2019-2024 represents a multi-sectoral approach to create a South Africa free from the harms associated with the drug abuse, drug misuse, and drug use. The plan observes also national and international policies, plans, and conventions to ensure respect of the people of South Africa. So if you are appointed as a member of the board of the authority, you will be expected to implement the authority's mandate. So if you could please share with the panel your understanding of the objectives of the National Drug Master Plan 2019-2024, and how you think the CDA would achieve those objectives of the plan. And the time is 8 minutes that we will discuss with.
Thank you, Honorable Member. Firstly, let's start at the baseline for the plan itself. Because, for example, the CDA has a responsibility to make sure that as the plan is developed and is even improved, it is developed and improved in such a way that its implementation will be able to cater from international, national, provincial, and local. So that is one of the areas of intervention for the development and implementation. But then beyond that, it is also important, of course, even with the plan 2019 to 2024, more and more the focus is let it be evidence-based instead of ad hoc and just sporadic. So we need to make sure that there is the evidence of when there are activities or programs or projects that they are delivering to the pillars, they are addressing, they're delivering to the 3 pillars, they are addressing the 3 levels of intervention, for example, and that in the process, there is also maximization of the opportunity of that intersectoral approach. Because when there is an intersectoral approach, we are able to use different minds and at the same time also resources to maximize on the delivery of the master plan itself. And of course, we also have to align to the international norms because, for example, we are members of UN as a government. So internationally, we have to be able to be responsive at that level. We have signed certain treaties that actually speaks to us having a more meaningful intervention and beginning to interrelate. For example, when you look at the abuse of women and children on the one end, whereby the substance abuse and alcohol abuse has a very, at times I want to call it direct, even though I might be challenged that no, I should not say that. But I'm saying it has a direct impact. So such treaties, relating them at an international level, bringing them to grassroots for what we have to do. Because at a local level, when we pull them down, bring them to local level, then we will then be able to also have partners. For example, I believe that we could even challenge, just as one of the things that one can bring for intervention, we should actually challenge the private sector. They always have what they call corporate social investment. Part of it, they'll say it will go to education. I'm talking of also related areas where when you have to do intervention, there's not much resources, where we can be able to have resources coming from them so that we are able to also have meaningful, impactful implementation of programs, but significantly monitoring and evaluating what has been done and reviewing. We're not necessarily reviewing the plan because it has a duration of implementation, but as we implement, we should review whether what we are doing has impact and impact us in the community, because ultimately we want to shift the resources from focusing on alcohol and substance abuse to catering for the need and the poor and the vulnerable of the community, for bringing a better life to those in the community. So we have to have that holistic approach. So I believe that that's one of the contributions, that having also worked in different arenas, be it education, social development, even health, one could be able to bring that synergy. Thank you. Thank you. Okay, thank you, Honorable Member. The one thing that was realized is that the plan had to just graduate from just focusing on the specific areas of intervention, but begin to be more evidence-based. That's one area that had to be considered. Another area was that in terms of the implementation of the plan itself, there has to be the strengthening of a coordinated and a focused operation, and that not just the oversight, but actually in terms of the programs and at the implementation level, in all, I'm going to just say all spheres of government, from national to local. And also in terms of the evaluation, there was a challenge that there isn't much shift in terms of really the making a difference in that area of intervention. For example, we are having the majority of young people who are abusers in many ways. We have 20% of the community, being in that also sphere. So there had to be a strengthening of the intersectoral and integrated process. to be able to mitigate the challenges.
Good afternoon. What is your understanding of good governance, including its main features, and how would you ensure good governance in the CDA?
Thank you very much, Honorable Member. When we have to talk about good governance, we have to go to ethics as one of the strengths of good governance. We have to be able to be ethical in our operations. We have to remember that good governance says when we are given the responsibility to oversee, we have fiduciary duties to carry that responsibility with due care. And at times we even have to have due diligence to be sure that our oversight, if at all we are having to make sure that what is outlined, for example, in the plan itself, will be carried, that we also have to be good citizens. There would not be good governance when we would abuse the resources, for example, that are allocated, or not even utilize them. Because sometimes we think about abuse, but we forget that even the non-utilization for the correct purpose is poor governance. And also remembering that with good governance, we have the overall good of the community. It cannot be a sectarian focus. It has to be all who are benefiting at the responsibility of intervention, and not, lastly, not interfering in the work of the implementers. Thank you, sir. Ma'am.
What are the key issues affecting young people, families, and communities regarding drug and substance abuse? How would you advise the government to deal with these issues?
Thank you, Honorable Member. That is my cry, actually. One of the most painful things I observe when we do interventions, especially for young people, is that, and it's a whole spectrum, there's an assumption that those young people who get into drugs are those that already are out of order or whatever. Now we're even seeing a trend of unemployed graduates as young people who are more and more getting into substance abuse. And even the kind of drugs that you don't think, they'll get into Nyaupe, and you don't think that when somebody is a graduate would even consider such. But they tell you that, our reality is out there. It's the issues of, actually, they're starting with inequality, that they are finding themselves, especially, and allow me to use African, because that's also the slant that we have observed, because a lot of young African, and more on the side of male equally, are saying that, the triple oppression is challenging them, the inequality, the unemployment, and also where the interventions are a challenge. Some of them are users, and having to just find a place for them to get help, it's one of the most challenging things. So they are challenged by not being able to be socially and financially stable, and then being challenged by having interventions to help them to overcome, or sometimes even deal with the challenge of substance abuse, and then overcome it and stay clean. The other challenge that they're having, before I just come quickly to what I would do, that we have been observing more and more, is just the fabric of society that is disintegrated. Because most of them do not know whom to go to, who can make them stand strong. They don't have parental support and role models in communities to be able to be better citizens and not abuse. what would be the key intervention? Okay, I'm going to be practical on what we've been doing. We actually have been engaging directly with young people, some who are not yet abusers, but they're at risk, to say what would be the best way for you. Because it's one thing for us to come with beautiful theories, but it's important to have that consultation with them. So that is one critical intervention that we need to get into. The other element is how we also look at socio-economic interventions. When I say that, for example, when they say, no, I want to get out of using drugs as a young person, when we have given them treatment, where do we take them to? We don't look at the economic component, or even developing skills that will help them to stay clean and be able to find an alternative for work. Okay, I'm told I'm beyond time. Sorry. Okay, sorry. Sorry, Honorable Chair.
Thank you, Chairperson. Ms. Mabue, in your opinion, what is the state of public rehab centers? Now, I know you've said a little bit about it, but maybe you can just give us a little bit more info. And are there any challenges with regard to access to public rehab centers in South Africa? If yes, what are those challenges, and how would you advise the country to address these challenges?
I'll try to be brief to the point, Honorable Member. Firstly, no adequate centers. Number two, the quality of service. And even for many who even are trying to go private, the price, it does not give one access. And the intervention models, because as I was just saying briefly, the intervention model should be in such a way that when somebody is being rehabilitated, we reduce the opportunity of relapse with looking at beyond the center itself. However, what I would say we should do as a country and the government is to look at a holistic chain, I'll call it a value chain, to be able to say, certain communities, okay, we know where the high challenges are. We should begin to have rehabilitation centers in those communities instead of somebody waiting forever. And then even when we do, we should have the intervention program, skills development, opportunities for entrepreneurship and so on and so forth when they go out, so that they are diverted to good versus opportunity to go back and relapse.
Thank you.
I'm just interested to know about aftercare.
Sure, yeah. that, allow me to use the word, honorable members, is a nightmare in many communities. Because they get out of rehabilitation center, what do? We dump them back to families and communities who do not know what to do with them. And that is one critical area. That's why I was saying we should have the kind of interventions that are gonna not only cushion them, but receive them as aftercare and sustain the programs beyond being in the center. So it's one area that is neglected in the highest form, especially in rural and township communities. Yes. Thank you.
Okay. Yeah, thank you. One of the challenges facing the country is the lack of comprehensive national statistics on the prevalence of substance and drug abuse. How can the CDA, Central Drug Authority, play a role in this regard?
Thank you, Honourable Member. We have stats South Africa, and I believe that when we really want to get stats, we could even have as a component of one of the items, because we now will have a national spread. Have CDA developing, maybe it could even be called a sub-survey or a questionnaire, to be able to get information easier and quicker. Because even when it can be from organizations, like civil society organizations are trying, you would have sporadic and ad hoc information. But I believe when it is built into a machinery for being able to get statistics, that would be one intervention. Thank you.
Thank you, Honorable Chairperson. Good afternoon, Member Boy. Recently, there's been much debate in the public discourse about the court judgment on the decriminalization for private use of marijuana, cannabis, and all of that. So I would like you to share what would be your opinion, if you would like to share it with us as a panel. Thanks.
Thank you, Honorable Member. Decriminalization was in substance, as I would want to put it, for what would be the good of cannabis in this manner, that some people can be able to use it for medicinal purposes, and whilst others are users, it is hoped that they would regulate. There are two things about marijuana. You either have somebody who uses in a good way or in a bad way. However, because we are not even educating, we are not enlightening community, unfortunately quite a bit is on the abusive way, because they don't know the impact, they don't know the psyche of the usage of something that is the same thing as alcohol and other substances. When we are not educating and we are not empowering, it will be disastrous. Yes.
During the COVID-19 pandemic, government has introduced a number of lockdown regulations to deal with the spread of the virus and also to contain it. So one of those lockdown regulations which was introduced was the ban on the sale of tobacco and alcohol. So in your response, can you please focus more on the alcohol component of it for 3 minutes? So if you had to advise government, what would be your advice to government? Thanks.
Thank you, Honorable Member. I know that there have been a lot of debates, though I would say especially for alcohol, there should even be a more stringent regulation, even beyond COVID. Because I believe that the experience of COVID-19 and the regulation of alcohol has shown the community that there can be a difference. Because there were less casualties, for example. Yes, whilst there was an increment in the abuse within families or women and children, yet the intervention to regulate and more stringently was helpful, especially for alcohol. So, and also at the same time, education in terms of the use of alcohol, because many people have learned, even though they were learning in the wrong way, that, hey, there's a regulation, we're not drinking. However, I believe that when they are, educated, that you can actually be a social drinker and drink better, then it will assist and then it will reduce the challenge of substance abuse. I'm saying when they can be educated on how to even be social drinkers, because now they became binge drinkers. When there was a reopening, they're like, oh, hallelujah, now we can drink forever. So that regulation would assist. Thank you, Chair. Baba? No, yes, binge drinking. They would just drink. They're saying that drinking for the sake of the time they could not drink.
That was a nice parting shot. I will not forget that one. I'll be watching these binge drinkers, and I will not allow them in my place. Said, you are a binge drinker. Right. Thank Ms. Sophia Ralebua. the energy you have shown, passion, and some eloquence. We must thank you very much. So these ups and downs on the road didn't disturb you much. Thank you so much. Do you have any question or a comment for the panel?
No question, Honorable Chair, but not even a comment, a note of appreciation. Because the committee, like again, could have said, no, we will see what to do because they are not here. So we appreciate that. And for me, most significantly, the recommitment to make sure that there would be a CDA that carries its mandate and for the benefit and the purpose of the community. So that is the comment I would give from the point that when the equation will change, we will have a lot more time of families, we'll have a lot more resources that government would not have to spend on treatment and other ills, and we will have a better society. So that's my comment. Thank you very much, Honorable Chair, and to all the members.
You know, thank you, Mayor. I think I want to say some of us are new in this sector, but we're learning very fast. What a huge role this committee has in this area. Not just the CDA, but the committee as a whole. I think the weight of the burden of the effects of drugs in society is so huge that we need innovation, creativity. Pure laws on their own will not resolve this. So a partnership between CDA and the committee is going to be the one that is going to be very key. We are motivated the more we appreciate the depth of the challenge. Thank you so much, man. It's amaele ka khotso. Re tshepa hore ha o khutla mathata a ka se o phete. Thank you very much. Thank you very much, Ma'am Sophia. Honorable members, can I take this opportunity to thank all of you so far on behalf of yourselves. The commitment, the discipline. I've seen some members, when exercises of this nature take place, they disappear. That is not referring to me. But the punctuality was amazing. And I must make this confession. I have not worked with such a disciplined committee for a long time. And I think the more we gather momentum, the more this committee is going to make a difference. There's a lot that we need to learn together. I'm going to have a session with the staff before we come to the portfolio committee to just do an exercise on the implementation of the scientific oversight model that was adopted by this parliament a long time ago. Because we need to take our work to a higher level where we analyze reports that we can scientifically link with the situation of the people, so that when the departments present, you are able to analyze and say scientifically, is there a relationship between this which is being presented here and what it is intending to do. Sometimes we take that knowledge for granted. We need to be trained, we need to grow collectively for the sake of this country. And I think a disciplined committee like this deserves further exposure to these things. Of course, our unparalleled staff, they are just, and I also want to clap hands for them. I was saying, they usually say, for God so loved the world, he brought his only begotten son. But I usually say, for God so loved Monli, for he always provides him with teams of people who are very committed and passionate. And I say, for God so loved Monli, and I'm so grateful about that. So this team, honorable members, since I met them in 2019, have not put a foot wrong. And I think what I'm saying now must not mess them up. Instead, it must take them to a higher level. You guys are good. Let's give them another one. So what they are going to do now, they'll compile a report. We're not going to discuss it now. Compile a report so that on Wednesday we adopt it. But whatever interactions that are going to occur, because at the end of the day, it's a democratic decision. It's not a normal employment. It's a democratic decision. But that decision, no matter how democratic it is, there must be no embarrassing gap between the performance of the people here and that decision. That's all my prayer. If there was one thing that will insult this committee, is when we make a deal that insults the competence, the performance that occurred here. So I thought I want to emphasize that. When somebody look at him and say, these names are consistent with what we saw. So whatever we do, this is a political environment. That's always my minimum prayer. Competency, competency, competence. At the end of the day, these things are not going to be executed by the people we love because we love them. They will be executed by the people who are capable. And if we love this country, we must give this country competent people to serve this country. It's good to love them, but that's not enough. The primary thing, they must be capable. So we'll meet on Wednesday with the powers so vested in me thus far. For this moment, I declare the meeting urgent. Thank you very much. Okay. Man, before we did dodge.